At this time, I'd like to ask Reverend Gay Morris to come forward and lead us in an invocation, please. Thank you for being here this morning, Ms. Morris.
Thank you, and good morning. It's nice to be here with you. To inspire wisdom in leadership, this morning I'd like to share a prayer attributed to a name in the English history of our land, Sir Francis Drake, and this is simply called Drake's Prayer. Disturb us, Lord, when we are too well pleased with ourselves, when our dreams have come true because we have dreamed too little, when we arrived safely because we sailed too close to the shore. Disturb us, Lord, when with the abundance of things we possess, we have lost our thirst for the waters of life. Having fallen in love with life, we have ceased to dream of eternity, and in our efforts to build a new earth, we have allowed our vision of heaven, the new heaven, to dim. Disturb us, Lord, to dare more boldly, to venture on wider seas where storms will show your mastery, where losing sight of land, we shall find the stars. We ask you to push back the horizons of our hopes and to push into the future in strength, courage, hope, and love. Amen.
Amen. Amen. Thank you, Reverend Morris. May we stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Reverend Commissioner Tobin is not able to be with us again today. I would, that's probably him calling now.
No, it ain't. It's my wife. Sorry.
Hello? Hello? Hello?
I would ask that you continue to keep Commissioner Tobin in your thoughts and prayers. County Manager.
Good morning, Mr. Chairman. Item 1 on the agenda is the chairman's opening remarks.
Just have a couple of things this morning to mention to you. I want to thank everyone that came out on the 25th of January to the State of the County. We had an outstanding attendance. It was sold out. Within 36 hours of us posting it, we had almost 225 people present there. It's as much as we can hold at Camden, George's. But for those of you that did not see the State of the County, you can certainly go online to our website, and that's posted there, and it's a YouTube connection that you can go to and see the full presentation. It's runs about an hour and 10 minutes. So I encourage you to go take a look at that. And then certainly the second item I have this morning is, as most of you are aware, we have been studying NC-12. I established NC-12 task force about a year and a half ago, and we had a subcommittee that did a lot of research, and county manager chaired that for the NC-12 task force with multiple stakeholders involved, and we will have a meeting tomorrow at 11 a.m. on the results from the subcommittee. They evaluated 8 hotspots in 12, and they're going to present their findings to us tomorrow, and then the task force will take steps to try to move forward and work on those issues that they bring forward to us. So stay tuned, and we'll keep you posted on that as to where we go with the NC-12 task force. County Manager, with that said, that completes my comments for this morning.
Jim, that brings us to item 2 on the agenda, and this is the presentation of the county service pins. And first on my list is Radcliffe Hester, come up to get a 10-year pin. Y'all see Radcliffe in and out when you walk in and out the door. Radcliffe, he's been with us now 10 years, obviously, for a 10-year pin. 7.5 of those years he worked over in Parks and Rec. Tim White would normally be giving this, but he couldn't be here today, so you got stuck with me. It's funny, Radcliffe worked in Parks and Rec for all those years, and when the transportation director left over here, we were looking for a new person to go in, and Tim says, "I got just the man. I've got just the man." I said, "Well, who is just the man?" He said, "Radcliffe, he works for me over in Parks and Rec." I said, "What does he know about transportation?" Well, nothing, but he's just the man. He's just the man. And I said, "Well, how are we going to get somebody in here that can work that doesn't know anything about it?" "Well, he's just the man. He's just the man." I said, "Okay, Tim, it's your hire. Let's go with it." Well, he's just the man. He stepped into that position as green as a gourd. I mean, he could probably drive a bus, but other than that, he knew nothing about it. And I'll dare say we didn't miss a beat. The transportation department has run smoothly. He guided it through COVID and all the stuff that you won't believe that we had to go through with transportation there. He did it with a smile. He did it, and we didn't get complaints that people like him. And I can't say enough good things about him other than he's the man. So thank you so much, and thank you for 10 years.
Thank you.
There you go. Next is April Ferentz would come up to get her 15-year pin from Hosey Wilson.
Good morning.
Good morning, Mr. Chairman, Commissioners. I'm really happy to be here today to present April her 15-year pin. It was like yesterday I was presenting her 10-year pin. A lot has happened since then. She started in 2008. And before I run through that, I'm gonna tell you a little bit about what she did before this. She wants to put the timer on me up here, but we don't have to do that now. But before she came to work for the county, April out of high school went to work at C-Mart Foods. And she worked at C-Mart Foods from 1999 to, or 1989 to 2007, if that's correct. And when the store closed, she was the assistant manager of the Nags Head store. So that, after spending that much time doing something like that, and then the store closure, presented a challenge to April, I'm sure, and her family, which was young at the time. She has 2 children. She and her husband, Brent, have 2 children, 2 girls. They are Lauren and Brittany, and they are in their 20s, about the same age as my children. So that's a challenge they had to face a long time ago. So she came to work for the county in 2008 in the health department. She worked there as an accounting clerk for about a year. Then she moved to our department where she became a business personal property appraiser. She was in that role about 2 years, and she moved to the office support specialist role, where she served there until about 2014. And she became a real property appraiser. She was promoted to that position based on her knowledge and abilities. And so that was about the time that I started. And April and I have been working closely together for about 8 years now. So in 2021, she was promoted again to senior real property appraiser. We certainly understood her capabilities and her intelligence and her dedication to the position and the department. So in October of 22, she was promoted again to the assistant county assessor position, and she's been in that role approximately 6 months. And the reason I say all that is because that's a testament that hard work pays off, training pays off, and education pays off. She's taken advantage of all the educational opportunities that are offered through our association through IAAO, which doesn't mean anything to anyone except for those of us that are in the tax business. It's an international association of assessing officers. So in 2020, she met the requirements of the AAS designation, which is Assessment Administration Specialist. And she was, that year, I think it was July or August, she received that designation through that organization. Just to give you a little bit of information on that requires 6 appraisal courses. It requires tenure in the position for a number of years. There's an 8-hour case study examination, and there's a 4-hour master examination. So in addition to that designation, she's certified by North Carolina Department of Revenue as a real property appraiser 2 and a personal property appraiser 1. She's also certified through our association, NCAAO, as a real property appraiser, certified real property appraiser, personal and real. So a couple of things I wrote for 2020-10 PIN, which hasn't changed any. April is dedicated to whatever task she is assigned, and her talents are limitless. She is a true asset to the department, and we hope she plans to stay a very long time. So with that, congratulations, April. You've got a lot of your coworkers back there today to support you in your endeavors. Best of luck, because you're going to be seeing a lot more of her lately in her new role. So congrats, April.
Next, if Melissa Turnage would come forward to receive her 20-year pin from Beth Bradley.
Hey, good morning.
Good morning.
Good morning. I'm Beth Bradley. I'm the Adult Services Supervisor for the Department of Health and Human Services, and it's my pleasure to be here today to express my gratitude and appreciation for Melissa Turnage. She receives her 20-year pin today, and I'm so proud to have had the chance to have worked with her. She spent many years as a CC4C social worker, then she moved to foster care, and now she's an adult services social worker. And I think a common thread throughout Melissa's work is that she advocates for people who can't advocate for themselves. Melissa has many admirable qualities, but I think that's one of my favorite things about her. I'll call her personally if I need courage in a situation, and she'll help me find it. She's tough when she needs to be. She makes situations better. Her primary role is to evaluate adults for adult protective services. And these situations can be upsetting, they can be dangerous, they can be frustrating. But she deals with these life or death situations with clients, and she acts quickly and she does the right thing. I cannot begin to count over the 9 years the people who live a better life because Melissa was involved in their care. She's a hard worker, and she doesn't stop until she's satisfied with the level that she has provided to these clients. So Melissa, while we're here and a lot of witnesses, are you good going ahead and committing to 20 more years? Everybody's watching.
Maybe 10.
So it's been a pleasure to work with you. I'm excited to see what the future holds. Thank you for everything you've done for our unit and our agency and the people of our county. They're better off because of you.
Thank you.
Awesome.
Thank you.
Chairman, item 3 on the agenda is our Employee of the Month. We've been doing Employee of the Months for, I don't know, as long as I've been here. And I'm not sure, but this might be the first or maybe the second time that I've ever had the opportunity to make the presentation. And I'm delighted to do it because the person getting it this morning is so well deserving. Jackie, if you come right up here, please. So Jackie, believe it or not, might be our longest tenured employee. She's been with us for 38 years. She started back in 1985 as the clerk to the planning board and the planning director, and I see Donna's here this morning. In 2013, she became a senior elections specialist, and in 2020, she became the elections director. And when I think about Jackie, the first thing I think about is that smile that she just showed you when she walked up here. She's always smiling. During her time that she was with the planning, she was the face of the planning board, the planning staff. When someone walked in the front door, that's who they saw. And people came in not always happy with what Donna was making them do. But Jackie was the person that saw them, calmed them down, told them what they needed to do, got everybody straight, kept everybody happy, and kept the wheels turning and kept things going smoother. She's calm and thoughtful at all times. You'd never see her angry, even when she probably should be angry. And it's amazing that she can keep her composure and do the things with some of the things that people that she's had to deal with over the course of her career. The second thing that I think of when I think of her is dedication. During her 38 years at whatever job she's done it to the fullest. And she's been here, she comes to work, she puts in the time, she does what she has to do, and she's been a super and a loyal county employee, a loyal staff member, not just to me, but to the other folks that she's worked with in the county. In 2013, she, after 28 years in the planning department, decided she wanted to do something a little different and came over to the elections. We call it a senior election specialist, but effectively it was the deputy director, the second person in there. And in the election department, much as in the planning department, she was the first face that you saw when you came in. She was the one that handled most of the problems, because most of the problems can be handled out on the front desk, and she did that for a number of years. In August of 2020, our elections director left. If you recall, 2020 was a presidential election year. This was a few months before the election. It was an election that was going to receive a lot of scrutiny, had already received a lot of scrutiny. There were a lot of things going on, a lot of balls hanging in the air, and everything was kind of chaotic, not just in Dare County, but throughout the whole state and the country. I'll have to tell you, Jackie stepped into that void, and things were not chaotic in Dare County. Our election went smooth. There weren't times when I think Jackie probably could have pulled her hair out or choked somebody, but for the most part, things went smoothly. I know that the things that I know that went on are all things that we dealt with and that Jackie dealt with. From the public perspective, the election went off without a hitch. People came in, they voted. And this is a person that stepped up when somebody needed to step up. Most people at that time, if they had 28 or 30 years in, would have said, nah, no way, I'm diving into this. I think I'll go ahead and take my leave, and it's been a good career. When we talked to Jackie about it, she didn't even blink. She said, yeah, I can do it. I said, are you sure you can handle it? She says, I got it. Don't you worry, Bobby. We can take care of it. And she did. And we haven't missed a beat since. Can't thank you enough for all that effort, and can't thank you enough for all that you've done for the county over the whole 38 years of your career, and this Employee of the Month is well deserved.
Hear, hear.
Thank you.
Yep.
I think that was one of those gotcha moments for Jackie. I'm sitting out here and looking out there when Bobby mentioned that. Her eyes looked like a deer in headlights. Well deserved, Jackie.
Next, we'll do our Employee of the Year, and Sheila Davies would come forward to make that presentation. No, oh, I'm sorry. That's what it says on my sheet. Elizabeth will come up and make that presentation.
Well, good morning.
Good morning, Elizabeth.
I'm honored today to be presenting the 2022 Dare County Employee of the Year. Dare County's employees are our #1 asset. They give it their all to make the county the best. Dare County would not be what it is if it wasn't for our employees who work tirelessly around the clock to provide for our residents and visitors. We are extremely fortunate to have 770 true gems. Each month, subordinates, supervisors, and department heads nominate employees who go above and beyond in the line of duty, employees who go the extra mile, and employees who shine bright. The nominations come to Human Resources, and then the Employee of the Month Committee meets to discuss and decide on the stellar employee. The committee is made up of past employees of the month recipients. At this time, I would like to introduce those on the committee. If you would please stand and remain standing. Shannon Glaser, Friends of Youth. Kristen Stilson, Information Technology. Cameron Thompson, Department of Health and Human Services. And Christy Wright in Human Resources. Thank you, all of you, for making 2022 a wonderful success and the fun that we've had and all the laughs. So thank you. The Employee of the Year is chosen from 12 recipients that received Employee of the Month in 2022. Now for the Employee of the Month recipients. Please stand and remain standing. Jeff Mitchell, EMS. Caitlin Kite, Public Relations. Jessica Perro, Water. Willie Spencer, Department of Health and Human Services, Social Services Division. Avery Whitfield, EMS. Amy Elkins, Communications. Akra Stein, Parks and Recreation. Olga Roberts, Health. Matthew Cartwright, EMS. Stephen Stetson, Communications. Ray Griggs, Facility Maintenance. And Kelly Aiken, Health. Thank you all for what you do to make Dare County a wonderful place to work and live. You are truly an asset. Now for the 2022 Employee of the Year. Congratulations to telecommunicator shift supervisor, Amy Elkins. This is for you.
Thank you.
And this is for you too. And now Jack is going to say something.
Okay.
Good morning.
Good morning.
Good morning.
Hey.
Thank you all. It's a big honor and a privilege to be up here to give one of my staff the Employee of the Year for the county. This is Amy Elkins. She's from Wanchese. Her family is back here. We've kept them hid. They're all here. She started with the Sheriff's Office in 2009 and then started getting promoted up in 2014. And now she serves as a shift supervisor, so she's in charge of everything that happens in the room when she's working. She supervises the C shift. Public safety and a duty to others is something that runs in her family. Her father is retired fire service, was the fire chief in Roanoke Island for many years. Her sister serves in the fire service, and now her teenage daughter has joined the fire department, and she is beginning her life in public safety as well. When we think about Amy, we think about steady, dependable, and calm. She never wavers. She's always at work. She always fills in. She always helps. She always pitches in. If somebody's sick, she's the first one that'll come in and fill in. With the job at the communications center, we've got to keep 5 seats filled at all times to be able to cover the needs of the 3 counties. If somebody's sick, Amy's always there. She's always calm, no matter what the call is, whether they're delivering a baby on the phone, doing CPR on the phone, or there's a deputy in a car chase, or an officer screaming shots fired on the radio. She's always calm, always the same tone, and always providing the best level of service to everybody. We have supervisors meetings, and when we go there, she doesn't bring not only issues, but she brings solutions to those issues. She thinks about them beforehand, and she said, this is an issue, but this is what we can do to fix them, and lays out things. And it makes my job so much easier because she's always thinking and always there. Her attitude is the best you can ever imagine. On January the 10th this year, we switched to a new computer-aided dispatch program. As you know, it's a very expensive program. But we switched to that program, and it flipped their lives upside down. Everything they did for the last 22 years just got flipped upside down. They have to do it a different way. It's a new program. It's a new way of entering things. It's just their whole life always positive, always upbeat, never negative, always looking to help, always smiling. It's just amazing. It's like the worst time in a telecommunicator's career was January the 10th, and she was happy. Everybody's always happy. I don't understand it. But her attitude is infectious towards everybody. She has a very happy shift. She continues to help out, like I said, anytime. She's always professional, and she's always exemplary in everything she does. I am 100% grateful and thankful for everything she does for us. The stuff that she doesn't even know that she does. Just by her mere presence helps everything on the shift. So thank you very much.
Before we go to public comment, with those of you that received an award this morning, please go right out through these doors so that we can get some more pictures. Ladies and gentlemen, now's the time that's been set aside for public comment. If you have public comment this morning and you've not signed up, please raise your hand. I'll recognize you. When I do, please come to the podium. Please state your name and where you're from. Please limit your comments to 5 minutes. There's a green light that'll come on when your time begins. There's a yellow light that'll come on when you have about a minute left. And when the red light comes on, you need to conclude your remarks. Do we have a sign-up machine?
I apologize.
First on the list is Ralph Burrell.
What was the last name?
Burrell, B-A-R-I-L-E.
Welcome this morning, Mr. Burrell.
Good morning, Mr. Chairman, Commissioners. As the manager said, my name is Ralph Burrell. I reside at 154 Pine Road in Wanchese. I'm here this morning to discuss the Cluster Home Ordinance 2231-1. It was brought to our attention in the Village of the Village of Wanchese a few weeks ago about a cluster housing development that was going in. We had a community meeting which about 150 residents showed up at. Commissioner Avon was also there. We appreciated his presence. And out of the 150 residents that were there, nobody knew about this ordinance change. We were a little bit taken back by that because in 2004, when the commissioners wanted to zone Wanchese, they came to the community, and the community was very heavily involved in that decision-making process. We understand that this ordinance was advertised as by state statute, but we felt that the community outreach to the community got missed. So I'm here this morning to ask you if you would revisit that ordinance so the Wanchese community could give their input. And also, along with that, we would like to ask that a moratorium be put on any future plans that is going to the planning director be put on hold until this could be done at whatever time you feel like you can squeeze this into your very busy schedules. You know, keeping with the new motto of the county of caring for our community and having it a nurturing place to live and grow, we are hoping that you would give this great consideration. Thank you.
Thank you, sir. Appreciate it.
Next is Lorraine Tillett.
Welcome this morning, Ms. Tillett.
Good morning. My name is Lorraine Tillett, and I reside in Wanchese. And I'm here today to speak about the community of Wanchese and our concern to preserve our family fishing village atmosphere that's been conducted since the early 1800s. In 2004, Wanchese was the only land use on Roanoke Island that was not zoned. The commissioners at that time were very concerned that a potential explosion of growth from outside developers would come to Wanchese, as we are the only or the most accessible water in Dare County. We were given the opportunity, as Ralph mentioned, to draft our own community plan without planning board input. We were then to submit it to the planning board. After 2 years of weekly meetings, road by roads, we put our plan in, and this is the result of what we put in. And we worked very hard to do that. The Board of Commissioners approved our plan in 2006. We had 12 designated zoning districts, an innovative zoning plan that had no changes, but the plan was unlike any in Dare County, including all of the towns in the rest of our county. The guest house in our ordinance was created by us. And that had never been heard of, but we wanted to provide housing for our families if need be, and we created what you all call the accessory dwelling unit. The zoning set a milestone in North Carolina for 2 principal residents. The Board of Commissioners were honored with Sea Grant by the Pelican Award for their efforts in the Wanchese zoning, and you all will have a copy of that in your packet. Had our community known about the zoning amendments, we would have been here. Now we have to face a proposed cluster development of 59 houses with 10 houses on 1 septic. We're not against growth. We're not against building, but we want our 15,000 square foot individual lots. I refer to Dare County Section 2272, Notice of Procedures, Zoning Text Amendments Number 5. We know that the newspaper ads and the county had it on their website and so forth as required. However, at the last paragraph of Notice of Procedures, it says, other notices, procedures may be implemented based on the specifics of the request and the number of properties involved. Now that concerns us in Wanchese because we had this zoning ordinance in place. The planning board minutes reflect on 2 occasions where Donna Creef requested the planning board to get public input on things that were coming before the board. One was an accessory dwelling unit, and one was when the Outer Bank Chamber of Commerce proposed housing amendments to our ordinance. Again, the Wanchese community could have been contacted through this special specific uses there, just as a matter of courtesy for its citizens. I request that the Board of Commissioners consider moratorium on Section 2231 cluster developments in the Wanchese District, to consider more strongholds to assure that our district will not be overwhelmed with housings designated as long-term 35-day occupancy. People will be moving in and out of our community as developed with this magnitude of this so-called village on Wharf Road. So I believe, according to the statutes too, that when a community is affected with their health, their welfare, and their well-being of the citizens of Wanchese, that we fit right into that category. Wanchese zoning, as adopted in 2006, shaped our community and our lives. And I thank you for the opportunity. You all have a packet that was distributed with my comments, and everything that I've said is backed up with my comments, and also a list of advertising and the awards that we received. I went down myself to receive it, and I would just like you to know that all over the East Coast, we have been known for our zoning technique and procedure in the Wanchese coastal village community. And I have gotten calls far south and as far north as communities in Maine on the coast that is considering protecting their community. And we want our lifestyle protected. As I said, we're not against building. We just want it done properly. We want to remain a single-family community. I thank you for your time and listening, and I thank you for your concern.
Thank you, Ms. Thank you.
Next is Bill Wilson.
Welcome this morning, Mr. Wilson.
Good morning. Good morning. I'm going to follow up a little bit on Lorraine's comments. I'm also a resident of Wanchese, live on E.R. Daniels Road. I was had just moved into the Wanchese community in early 2000 and was tasked to participate in this zoning ordinance that Lorraine had just spoken to. And it's almost embarrassing to be here after all the hard work when we found out there was going to be cluster housing and a change that had happened in 2018 that, as Ralph said, no one that we can find knew of had any comments on or anything, even though supposedly the notices were done properly. Again, probably embarrassment for a community to not understand what changes are being made within our community is troubling to us. One thing I'd like to read is that I think has merit was in the village residential, and you have a copy of this, in our village residential, what we would classify our scope and intent or our mission statement was the intent of this Wanchese Village residential zoning district is to preserve the traditional family fishing atmosphere while protecting the environmentally sensitive coastal wetlands and other unique features of the village of Wanchese. This district provides for and encourages single-family residential land use that permits a traditional village business, whereby the property owner resides on the premises, carries on a business use on site of the primary residence. The traditional village business is identified as a commercial accessory use to the residential district and has long been associated with the village of Wanchese. The district also supports mobile homes on an individual lot or parcel of land. in that individual lot of parcel of land that we understood started at 20,000 square feet was reduced to 15,000 feet when we received public water. Furthermore, the district will promote stable, permanent neighborhoods characterized by low vehicular traffic flows and low impact of development. That was the intent. The single-family district is designed to secure a comfortable, healthy, safe, and pleasant environment for those who live there, as well as future development of such neighborhoods. The Wanchese Village Residential District serves to protect the fishing village atmosphere and family-oriented business way of life, which gives the village its attractiveness both as a place to live and a place to visit. And I think this proposed development just flies against what the intent of our zoning was at the time. So I would ask you to look at that and see, and I think our mission statement should have been looked at prior to these changes being made. And again, it's unfortunate there was nobody from Wanchese that participated. Thank you.
Thank you, Mr. Wilson.
Next is Sandra Burrell.
Good morning.
Good morning and welcome.
My name is Sandra Burrell, and I live in Wanchese. We've lived there for 45 years. I would like to give you petitions regarding the amended Section 2231.1 cluster home developments that was adopted on 10/15/2018. There are 545 signatures and several letters of citizens and residents who are concerned with the newly adopted ordinance for the cluster homes. I would like to present these to you at this time. And thank you for your time.
Thank you.
Next is Danny Sawyer.
Welcome this morning, Mr. Sawyer.
Good morning. How are y'all this morning? I'm here with Outer Banks Baseball Association. First of all, I just want to say thank y'all for the much improvements you guys have helped funded, fix our fields in the Kitty Hawk 2 fields. Just want to say thank you very much. Our kids appreciate it. We're getting ready to start our baseball season, and we know that on the agenda, item number 12 is about the elementary and middle school first flight. Just want to let you know we support that, the MOU. We think it's great for our kids, and we need a lot more work done to our fields here in Dare County. Just on a baseball standpoint, I'm just got nominated to be president, so a lot of stuff is new to me, so I'm learning as I go. But we open our registration up, and by the end of this week, our registration ends on the 25th. We are already full. So we're going to start turning kids away from playing baseball because we don't have the facilities. So just want to bring that to you guys' attention, and just want to say thank y'all for the improvements you guys have done in our
Danny, how many kids are already enrolled that you're full? How many do we have that we are full? What is the number?
112 right now.
So that's our capacity, 112.
Well, we got, I think there's like 18 more spots available.
Okay.
So we're kind of limiting our spots for field uses, where we're going to have 6 rookie teams, 4 minor team, which is the age limit, and 4 major teams. So we are very much at capacity. I start turning kids away. So thank you, gentlemen and ladies. Have a good day.
Thank you, Mr. Sawyer.
Next is Brownie Douglas. I did.
You did, Brownie.
All right. All right. That's everyone that I have signed up. Would anyone else like to speak at public comment this morning? Any other speakers? Seeing none, do I have any public comment from Buxton?
No comment from Buxton.
With that, Mr. Chairman, we close the public comment, and that takes us to item 6 on the agenda, and that's the pet crematory accessory use special permit application. And our new planner, you will all see this morning, Savannah Newburn's here to make that presentation.
Good morning.
Good morning, Board and Commissioners. My name is Savannah Newbern, and I'm a planner that started with the Dare County Planning Department in December. And today we'll be reviewing a special use permit application that's been submitted by Pamela Anderson for a proposed pet crematory as an accessory use to the existing pet grooming and animal kennel facility, Ocean Sands Canine Resort. This came before you as a text amendment in November. You adopted this text amendment and established standards by which the special use permit shall comply, including a setback from residential dwellings, that the incinerator shall be contained inside a building, that a licensed and certified crematory operator shall be on staff, and that the cremation services shall be limited to domesticated animals, as well as the use shall comply with all local, federal, and state regulations, of course, and a copy provided to us should there be a need for a DEQ permit. However, per planning staff research, the incinerator proposed does not require an air quality permit from the North Carolina Department of Environmental Quality. The applicant's proposed plan has been reviewed and approved by the Dare County Fire Marshal, and it complies with the Dare County Code of Ordinances. The proposed hours of operation for the facility are between 8 a.m. and 5 p.m. as needed, and the pet crematory will be located inside of a structure. The draft SUP is attached for the board's review, and the notice procedures for this evidentiary hearing have been complied with. Staff does recommend the draft motion for approval, and I'm happy to answer any questions you may have about the proposed accessory use.
Okay, thank you. Board, does any board have any questions?
Just a real quick one. In the packet, we have a map.
Yes.
Not sure what I'm looking at the map. Do you have that map, Savannah?
I'm sorry, I can't hear you, sir.
There's a map
Yes.
in
the
our
site plan here?
packet. Could you explain what we're looking at? It's
Okay,
what I
so-
can make out is Williams Drive.
Yes, if you're looking at the structure on Williams Drive, this is at, by the way, 208 Williams Drive on Collington Island. To the south of the principal structure, you can see an existing concrete pad, a proposed concrete pad, and a proposed incinerator. And this itself right here is the subject of today's hearing. It's for this accessory use to the existing animal kennel.
I'll show it to you.
I have a copy as well here.
What is the N/F Carol Ann Angelos? Yeah, it's right there.
That's just an adjoining property owner.
Adjoining property.
And the dotted area is all marsh or wetland?
Yes, there is a large majority of the lot that has wetlands on it, and then this
Yes.
is the proposed
Right.
location.
Okay, thank you, Savannah, I got it.
No problem.
Is the applicant here?
Yes.
Yes.
Ms. Anderson, yes.
Raise your right hand. Swear the statement you're about to make in this special use permit that you code truth and nothing but the truth, so help you God.
I got a couple questions. You heard the presentation by Savannah. Do you agree and confirm the information that she provided to the board?
Yes.
Okay. And do you consent to the submission of the documentation that's in her file to the board as evidence in this hearing?
Yes.
Okay. And then do you consent to the terms and the conditions of the special use permit?
Yes.
Okay.
I think you recall when we had first brought this to our attention, I went out to review the site and met the applicant there. They have spoken with their neighbors across the street. That's what determined the distance that you have in here, that the neighbors were agreeable to. On each side of the property is wooded area and wetlands, so there's no encroachment there. And they've also met with the folks that, with the church to the, I believe it's, I don't see what, northeast.
Liberty.
Liberty.
Liberty, that they're agreeable to it, so I found it be very, very well received down in that area. And like I said, they're going to actually build a building on that slab for the crematory. So Just thought I'd remind you of that I went out there to see that, and their neighbors had approved of it, so I just make that comment. Anybody have any questions of the applicant? Hearing none, then the pleasure of the board.
Move that SUP number 2-2023 for the proposed accessory pet crematory at Ocean Sands K9 Resort, Collington, North Carolina, be approved.
Okay.
Second.
Okay, there's a motion on the floor by the vice chairman. It's been seconded by Commissioner Bateman. Any further discussion? Hearing none, those in favor of the motion then signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.
I'd just like to say something to Chairman Woodard.
Yes, ma'am.
The presentation that you gave at the State of the County was spectacular.
Oh, thank you. Very kind of you.
Having people there that actually were the face of the issues you were presenting, to me, was brilliant. So thank you, and thank you all for your input for that meeting.
Thank you for your kind words.
Thank you, sir.
Chairman, that brings us to item 7 on the agenda, and we have Lynn Jenkins here to give us an update from the Community Care Clinic of Dare.
Welcome this morning, Ms. Jenkins.
Thank you. Good morning, Chairman and Commissioners. Good morning. I've brought 3 of my board members with me today. I have my Chair, Jennifer Allen, Vice Chair, Lisa Kimball, and Executive Committee Member, Sheila Davies. And I'm thrilled for their support. I have a wonderful board. So good morning. I want to first thank you all for your generous support and consideration of my request today. You all have supported the Community Care Clinic for many years before I got there, since 2005. And I just want to give you a few updates on the clinic and just remind you about us. We are the only focused primary care medical facility that is dedicated and focused to serving adults who do not have health insurance. And as you know, the most recent Community Health Needs Assessment reported that 15% of our county are uninsured. This is a figure higher than the state level and the national level. That means that over 5,500 of our residents do not have health insurance.
Wow.
If Medicaid expands, which it could this year, we would have an estimated 1,300 of those that would get Medicaid. But that leaves about 4,200 people that do not have health insurance and are self-pay. And that's just for health insurance. As you know, a lot of people have health insurance but don't have dental insurance. And coming in the spring of 2023, we are adding a safety net dental clinic to provide affordable sliding fee scale oral health care to Dare County residents, something that we get about 25 calls a week for dental needs. And you all spoke with us, and we listened, and now have, we offer Vivitrol, which is an opioid use disorder 30-day injection. And we're excited about that. It was through a grant with the Saving Lives Task Force with the opioid settlement funds. And through that grant, we will serve anybody in the community, not just adults who are marginalized or without health insurance. That's anybody that needs Vivitrol.
What is Vivitrol?
So Vivitrol is an injectable medication. It suppresses the craving for opioids and alcohol, and it's not a controlled substance. So the goal with Vivitrol is you get your injection 4 to 12 months, and then you're weaned off of that, and then you don't take any medication from then on.
Got it. Thank you.
So it's very different than Suboxone or methadone. And we're excited about that. So why do we need increased funding? Our patient volume is tripling when we open the dental clinic. Right now, and this number's old, I just ran it yesterday, we have now 766 patients that we've served in the last year, just for primary care. And we estimate 1,500 patients will be served in the dental clinic with our staff, dental dentist and hygienist in the first year. We've also integrated a new pharmacy into our clinic. And so that's 2 new service lines that we have. Our budget is expanding. Fiscal year 2023, it was $725,400. And for fiscal year 2024, the projected budget is $1,100,000 and change. That's increased staffing, accounting, overhead, insurance, IT, all of the above. So right now, some of our funding sources, of course, Dare County has provided us with $67,500 per year for a number of years. An increase to $100,000 would be very impactful and help us tremendously provide for our patients. Biggest funder is the state of North Carolina, $388,000 this year. Dare County Department of Health and Human Services, we partner with on many levels for our syringe service program, again, the Vivitrol program. Town of Nags Head gives us a very lovely rent discount. We only pay $1,000 a month for that 4,500 square foot building, which is incredible. Kill Devil Hills provides us with $10,000 a year. The Outer Banks Hospital is a great supporter of ours. $64,000 towards the executive director's salary, and then $20,000 goes to direct patient care for our patients. Local businesses, civic church groups, individuals, patients, totaling about $150,000 a year. Fundraising, we had our inaugural Billfish tournament last year and raised or netted about $70,000. That's going to become an annual event in September out of Oregon Inlet Fishing Center. So if anybody likes to fish, join us. And then other statewide organizations, $54,000. So by investing in the community care clinic, you're helping us serve the essential workers that are the foundation of this community. The majority of our patients work in restaurant kitchens, housekeeping, hotels, rental companies as cleaners, construction industry. Yes?
I'm sorry to keep interrupting.
That's okay.
The funding sources added up to $800,000, and the projected, you say 24 budget is $1.1 million.
Right.
That's $300,000 short.
Right. That's not, we also have some outstanding grants that have not been confirmed yet.
Okay.
Yeah.
Just wondered.
Yes, thank you. So fishing industry, landscapers, construction, all of these folks come to the community care clinic. The funding, increased funding would be used for all the service lines. We need to provide competitive salaries to get a dentist to come to the Outer Banks to be on staff for us. And I just wanted to let you know one last important issue. I'm reaching out today to Senator Norman Sanderson and Representative Keith Kidwell to invite them to come to the community care clinic. As a member of the North Carolina Association of Free and Charitable Clinics, our clinic, the Community Care Clinic of Dare, is part of the network. We are a network for adults who are uninsured across the state. There are 85 clinics. And we're asking them to support a recurring funding through the General Assembly for free and charitable clinics, among other organizations such as the federally qualified health centers, health departments. We're the only network that's focused on serving the uninsured. And across the state, if Medicaid expands, there will still be 700,000 adults without health insurance. And as a network, the free and charitable clinics are focused on serving those people. So thank you so much for your support. And does anyone have any questions?
Yeah, I do, Lynn. First of all, thank you very much for all you do for the people of Dare County.
Thank you.
Walk me through, one of my restaurant workers wants to come, got a cold, sick, wants to come into your place. He goes and fills out an application. How long before he gets service?
We are, of course, accepting new patients. We can get a new patient in within the week, especially if it's, we can triage them if it's something that is more urgent, as long as they can get their paperwork in.
Okay. And the pharmacy, it determines that he has to have an antibiotic and a protozoan. Your pharmacy gives that to them?
He can get that filled the same day if the pharmacist is there.
Okay.
If it's, right now, she's only 2 days a week due to funding. Otherwise, they could pick that up the next day or when she's there. Or if that's not soon enough for something that's more acute, we help them with a coupon and could send it to CVS or Walmart, wherever the least expensive place is.
Okay, when the pharmacy, when it's filled at your pharmacy, are they billed for that, or is that?
No, the medications are free.
Okay.
There are no charges for medications. There is only an administrative fee of $5 for a generic, low-cost medication. If it's a medication that is over $50 or a brand-name medication, it would be $10 charge of an administrative fee.
Wow, that's fantastic. And thank you for stepping up and doing the Vivitrol.
Oh, you're welcome.
That's really big.
You're welcome.
Billy Bob has insurance, and does he have to be prescribed from his physician to go get the shot with y'all, or do you prescribe the shot?
We have a dedicated nurse practitioner that's working under our medical director, John Sanchez. She is trained in medication-assisted treatment. She will meet with the patient, and she can prescribe, or if they have a prescription maybe from an outpatient an inpatient treatment center or a correctional facility where they're coming from, she can speak with them and either rewrite that prescription. Sometimes they'll come with one for 11 months. And so we can honor that. Of course, Billy Bob, who has insurance, we will have CVS or Walgreens fill the Vivitrol, send it to us so we can provide the injection, because they'll need to bill the insurance for the Vivitrol.
And if they don't have insurance, it's very, very expensive.
It is very, very expensive.
Do y'all cover that?
We can cover that and are working creatively through Trillium Health Resources, which is state behavioral health organization, to allot those funds through them. We are also looking for other grant funding through SAMHSA that could cover some behavioral health medications and just move the dollars around. We do have the $25,000 from the Dare County Department of Health and Human Services, which is covering more of the salaries, supplies, because you're right, it's about $1,000 a shot after they have a $500 patient assistance program, so it adds up.
Thank you.
You're welcome.
Lynn, just a question regarding Vivitrol again while we're on that subject. You mentioned in your earlier comments that the Vivitrol is a once-a-month injection, and that at the end of 12 months, it's no longer required. Did I understand that correctly?
It depends on the person.
It's the hope.
It could be 4 months, it could be 6 months, it could be 15 months, depending on where they are in their recovery. They're also getting required counseling weekly because it's a two-part treatment, behavioral health plus the medication treatment. So it depends on the person and the assessment of the nurse practitioner.
So
But the lovely thing is that then when they are deemed recovered through that medication, they do not have to continue getting a medication at that point. And it also works for alcohol addiction too.
Wow.
Very well.
Thank you.
The reason this is so big, we have places all over the United States that are prescribing Vivitrol when they check out from a 30-day clinic. And then we had no one here to administer the drug, and Dare County was doing it until they stepped up to the plate. And I can tell you that I have dealt with people who have taken the drug and are continuously sober right now. They go to AA meetings, of course, and counseling and everything. And they've transitioned from the shot once a month. Some have transitioned to a pill form, I believe.
There is naltrexone as an oral.
Right, to an oral pill form, which is much less expensive.
Definitely.
And
We have some that do take naltrexone now.
Well, and then also, and then got it off completely and are still clean and sober. So it's a really, really good alternative to alcohol and drugs.
Go ahead.
Are any of the patients residents of Manteo or Kitty Hawk or Southern Shores?
Absolutely. We have patients from,
Well, you missed my point.
oh, I'm sorry.
I saw contributions on your slide from Kill Devil Hills and from Nags Head.
We have a
Manio?
lot of Manio
Well,
patients.
that's what I'm asking. What
I
has
need to
Manio
go make a
said?
visit.
What has Kitty Hawk said? Southern Shores? Why aren't
Right.
they stepping up to this plate as well?
I have not gone to ask yet, but I'm going to put it on my agenda.
Put it on, Lynn. If you need help, I'll show up with you.
That would
How's
be
that?
great. That would be great. Yes, we have a
Got that,
lot
Mary
of
Helen?
patients from
Local
Manio.
towns will be pursued to additionally support this needed clinic. I'm just looking for them to step in.
Absolutely.
This is important, and I appreciate your presentation, Lynn. Thank you.
Thank you.
Chairman,
Yes, sir.
may I?
Yes, sir.
Can you clarify what's going on with dental? Do I understand that you have you're operating a platform of fundamental dental services, and now you want to expand?
Dental is, we were awarded a grant, congressionally directed spending grant of $423,000 through Senator Burr's office last year, and solely to renovate and purchase large dental equipment in our existing facility, the back corner. We're in the process right now. Mark Caston is our architect, and it is going to bid this week. And the equipment has been ordered, so this is going to be the initial dental. The clinic is expanding to add dental, more or less, and we'll have a staff dentist, hygienist, and 2 assistants, and it will run 4 days a week with the staff, and I'm hoping for Fridays to have rotating volunteer dentists to man the clinic on Fridays.
I think that I would strongly urge you to consider when you talk with Representative Kidwell to see what kind of relationship you can establish with the East Carolina Dental School.
Yes, and I actually have reached out to East Carolina, Dr. Temple there. Dr. Frank Alsban, who's retired dentist here, is helping me consult and connected the dots for me with Dr. Temple at East Carolina.
Lynn, just a matter of clarification. Did you say that you plan to have a dentist on site?
Yes, sir, on staff.
On staff?
Mm-hmm. Very important to
Good luck.
integrate oral health with, we're going to do it.
Yeah, I hope so. We've just been
We've
through
been
several
struggling.
years of trying to get one, and
It is so hard.
It has been a bear.
It is a
I'm just telling you.
bear. And I'm just, we're going to.
Well, I hope so.
I do have a number, Dr. Peter Erickson and Dr. Frank Osban, who have graciously both offered to come in and work until we get a staff. So if it's ready to be opened, we do have some commitment.
If you can get
from
volunteer
them.
help, that would be fantastic.
Yeah, it would
Yep.
be great.
Yep.
They're lovely.
Well, thank you so much, Lynn. That's
You're
very
welcome.
good information. We appreciate it.
Well, thank you all. Have a good day.
And that brings us to item 8 on the agenda, and Sheila Davies is here with a resolution.
Good morning, Sheila.
Good morning, Chairman, Commissioners. It's my pleasure to be before you this morning with an agenda item. It's a resolution requesting North Carolina General Assembly to pass legislation to protect our kids from vaping and nicotine addiction. Before I read the resolution, I would like to introduce Teresa Beardsley, who's here with me this morning. Teresa serves our region in North Carolina, the Eastern Region, Region 9, as the Tobacco Prevention Manager. Tobacco Control Prevention, I might have your title slightly off. She's worked with us for a number of years. She actually, even though she represents the region, her office is in our health department. And she is a vigilant advocate for prevention work in tobacco and with e-cigarettes and vaping. Teresa made a presentation to the Board of Health and Human Services back at our December meeting. And our board unanimously adopted the resolution that's before you today. And Vice Chairman Overman suggested we bring the same presentation and resolution to you all. So without further ado, I will turn this over to Teresa to share the presentation, and then I'll return with the resolution.
Thank you. Thank you for having us today. I am here just to share some information about youth e-cigarette use, as well as our Tobacco 21 law, our federal Tobacco 21 law, and how they kind of coincide. 95% of all tobacco users do start before the age of 21. So right there you can see that gap between school-age kids up to 21 years old. E-cigarettes are the #1 product used by youth. E-cigarette use does continue to increase, as you can see on the next chart. And just slow me down if you need more time. Youth e-cigarette use does continue to increase, and you can see that 24% increase between 2017 and 2019 right there. And it's just continuously increasing over time. On the next slide, youth tobacco use, the current use of any tobacco product, you can see, did they change it? There it is. Okay. You can see it's 18.85%, and the target for Healthy North Carolina 2030 is 9%. So you can see we have a lot of work to do in North Carolina. And you can see it's pretty steady across white, black, Hispanic, other non-Hispanic, and so forth. Pretty steady, pretty much the same. Young people primarily get their e-cigarettes from retail locations and vape shops. The most common social source of e-cigarettes among youth aged 13 to 17 is from a friend that's under the age of 21. All right, so looking at our evidence-based practices to decrease our youth e-cigarette use. Point of sale, which is our Tobacco 21, smoke-free policies, our hard-hitting media campaigns, access to cessation services through Quitline NC, through our Outer Banks Hospital, and then tobacco price increases. So we're here to talk about raising the age to establish a Tobacco 21 law that aligns with our federal law. North Carolina does need to raise the age to match this federal requirement that was passed in 2019. Many young people transition from this experimental use to regular daily use between the ages of 18 to 21. And of course, it's confusing to our retailers in regards to our state law being 18 and our federal law at 21. Now, there is the federal law, which is known as the SINAR Amendment, and it now requires states to do an annual inspection of a random sample of tobacco retailers to determine what percentage are selling to youth under the age of 21. If the percentage of underage sales goes above 20%, the state, of course, could be forced to lose millions of federal substance abuse prevention and treatment block grant monies.
Excuse me.
Yes, sir.
Is it legal to sell tobacco to a 20-year-old in North Carolina?
According to the North Carolina state law, yes.
But if I do, you're going to take massive amounts of state block grants from me.
According to the federal SINAR Amendment, yes, sir.
What could possibly go wrong? Honest to God, you guys are actually standing there explaining this dichotomy and saying the retailers are going to be the ones who are punished for following the law? Really? No? Sheila?
It's not the money that would be taken from the federal government is substance abuse prevention block grant money. So it's money that goes into the states to fund initiatives to prevent underage use. So it is a dichotomy, you're correct.
Yeah,
but as far as the retailers wouldn't be penalized. The retailers are, right now, you've got retailers that may work in one state that are implementing a law differently in the very next state beside it. 41 states currently are aligned with the federal law. North Carolina is not one of them.
Okay.
That's a good Good question. All right. So this is what Sheila just discussed right here with the map. You can see which states have a Tobacco 21 law and which do not. So you can see North Carolina, South Carolina, West Virginia are all still at 18 years of age. So here, this just explains further that 40 states also require a licensing, permitting of tobacco retailers as a tool to enforce their tobacco laws.
I had one other question.
Yes,
On the
sir.
previous map, California was listed as one of the 21, yes?
Yes, sir.
Is marijuana sale legal in California?
I focus on tobacco.
So you don't know.
I really
Sheila?
do not know the answer.
Sheila knows. I'm going to go with yes. Okay. Just as long as I know we've got all of our priorities in line. Please continue.
Sure, sure.
What's the age to buy it at, 18 or 21?
It doesn't matter. If you buy it, they're not going to prosecute or enforce anyway. Keep going now, I'm sorry.
No, sure. All right, so this slide just discusses a little bit about the retailer permitting system that is right aligned with ABC. It allows the state to know where the tobacco products are being sold so that we can align with the federal law in regards to the SINAR amendment with being able to provide those annual inspections. And next slide, please. There is a Tobacco 21 interagency work group that is working at the state level, of course, and with the North Carolina Alliance for Health. Just wanted to share who's involved, which stakeholders are involved with that interagency work group. That does include the North Carolina Department of Justice, of course, the ABC, the North Carolina Department of Revenue, Division of Public Health, Division of Public Safety as well. The ABC Commission has spoken that they are well situated to oversee the permitting of tobacco retailers, just like ABC, just like the alcohol ABC permit as well. And the ABC Commission does have the technical and infrastructure to do so. And right here is the evidence-based components from the CDC that we do need to have as part of our Tobacco 21 law. It does allow local government authority. It applies to all tobacco products. It requires that retailer permit. It requires, of course, ID checks, enough time for the retailers to receive education regarding the law, training, signage, and holds the retailers responsible, not necessarily the person that's purchasing. Provides minimal penalty to the purchaser. This is just a little piece. On April 5th, the legislative appointed Justice Warren Heart Disease and Stroke Prevention Task Force, they did unanimously vote to add recommendations for implementing a Tobacco 21 legislation. Of course, on August 17th, the North Carolina Association of Local Health Directors did the same. The Northeast North Carolina Partnership for Public Health, and also the North Carolina Alliance for Health. And then the next slide just discusses some of the boards of health that are receiving the same education as well, that have unanimously voted to include these components on a Tobacco 21 law. In our western part of the state, Appalachian Health District, Wilkes County, of course here, Dare County Health and Human Services, Durham County just recently, Chatham County, Northampton County Board of Health, Martin Terrell, Washington District Board of Health, and the North Carolina Citizens for Public Health. So in conclusion, of course, we're discussing the alarming increase of tobacco use of our young people, especially e-cigarettes. It's important that we prevent our young people from starting. to match this federal law of the Sign-R Amendment, it's important that we do raise as well the age to tobacco 21. And that's it.
Yeah, one more time, Sheila.
Yes.
Just so I got it right.
Okay.
All the other states that were held up as shining examples that we should follow, and that the federal government is very, very careful to support with grants and punish those who do not, have some of them little or no restrictions on the sale or broad-scale use of marijuana. Is that fair to say?
You know, I'm
Colorado,
not sure how many
California,
states.
Illinois, New York.
I wish I knew. I do not know how many states
I'm pretty
have
sure the
approved
four I
marijuana.
mentioned are.
I'm sorry.
I'm pretty sure California,
I-
Colorado, Illinois, and New York fall in that category.
There are definitely a handful without, and there's,
And from, again, anecdotal news stories, the level of prosecution or enforcement for violations of marijuana use are, how about zero? Okay? So I'm not arguing against your ruling. What infuriates me is the 20-year-old, man or woman, just returned from Eastern Europe deployment, goes into the Speedway, buys $20 worth of gas, and would like to buy a cigar. Put the cuffs on him. He's 20, just back from Eastern Europe, part of our armed services. Not a chance, pal.
so.
I just
and
struggle with this,
I would like to
okay?
clarify one thing that she mentioned in the presentation. The way most states are approaching this and the way the North Carolina, all of this advocacy work to the General Assembly is being approached, is that if this was adopted, if the state legislature adopted this law, and they put the systems in there through the ABC Commission to regulate and implement in your retail stores, the violation, the penalty per se, if there's a violation, is going to be more heavily on the agency selling. So the gas station for selling, because now you've got a law, you need to abide, just like you would if you were selling alcohol to under 21. The penalty to the purchaser,
Yeah,
that's
I
not where the
apologize,
focus
Sheila.
is.
The selling a quart of Fireball or a bottle of Fireball to an 18-year-old doesn't equate to me to the 19-year-old buying a cigar. I mean, I understand the comparison of enforcement.
And I understand. I mean, we're here certainly just as
I
public
know,
health advocates
I know,
because we
and I'm-
recognize,
You do.
unfortunately, our youth are getting their hands on the vaping and the tobacco products at an alarming increasing rate.
You know, and if I saw a consistency across the board, marijuana, vaping, cigarettes, pay attention, everyone. We're serious. We're not going to let this go on. Our youth are too important. You'd have me won over. But when I see the inconsistencies and hypocrisy, I struggle with it, you know? I'm not arguing your point,
I
Sheila.
understand. I do. And we are champion for Dare County, as you all do, but I get that. I really do. It's frustrating. Yes,
Let me
Commissioner
ask you,
Bateman.
are there any results back on whether we've met the 20% threshold in the results?
Do you know where our last for the?
Because wouldn't that pretty well trigger us to make a change legislatively?
If we were close or
Over
above that.
20%.
Yeah, do you remember
As
what
far
our
as
study?
The Sign-R Amendment with the 20%.
For Dare County?
I don't have a number for Dare County, no.
Would it have to be a state?
Yeah, it'd have to be the state.
Yeah. So is there a state number?
No, sir, there is not. And I'll tell you the reason why. There is not a specific list of tobacco retailers. So we don't have a list of tobacco retailers where enforcement can go in and check if they're selling under. Now, there are some studies being done right now. Rutgers University with East Carolina University. They have a study that's currently occurring right now within our region. And with 2 months, I want to say it was November and December of 2022. Within those 2 months, there was a 40% sales to those under the age of 21. Wow. That 40% of sales under the age of 21 that tried to purchase. Not overall sales, but that tried to purchase that were under 21.
Y'all, where's the pushback going to come through from on raising this to 21? Is it like the Retail Merchants Association? Knowing how those wheels turn, you're going to get some pushback from the gas station folks, and you know,
The
'cause-
tobacco state, I mean, that's where it's coming.
Yeah.
Yeah, I mean, without a doubt, this is a sensitive topic for some. I think it's, in light of where we are nationally now with the federal law in 2019, this has been a more recent push with public health. Really, if you saw, I mean, there's a handful of public health departments that have adopted these resolutions. We just did it in December. We're kind of ahead of the game a little bit across the state, which we typically are in Dare County. I think you're going to see more and more advocacy in this line of effort, or this line. However, recognizing there's going to be opposition for sure. I don't know ultimately where this will land, but.
Well, counties and other organizations like this, I would urge this board to consider, to support this resolution, because that's what it's going to take. If you got to fight with the big boys, then you better come with something to fight with.
Yeah, let's broaden it, Danny. Let's get on board and broaden it. How many federal grant monies, how much, do you guys know, are being withheld from states that have legalized marijuana? How much federal grant money has been?
I don't have marijuana data. I know specifically what's at jeopardy here is.
Anybody have a problem with marijuana? I do.
4 million?
I'm just one.
Does this not include vaping as well?
This includes vaping. This is vaping and cigarettes.
And we're seeing, I'll just say marijuana type substances included in vaping that underage, I say underage, less than 21-year-old kids are getting their hands on, right?
Absolutely.
So it's got a much far-reaching impact. The umbrella covers a whole lot of things here other than just cigarette smoke, which as we know will kill you. But the marijuana impacts through the vaping is just another area that lends itself toward doing the right thing as far as keeping kids less than 21 getting their hands on it. We've already seen where it impacts development of their brains, for crying out loud. I mean, and they're right in that zone where it does affect it. We had a young man here, gosh, it must have been 2 or 3 years ago, who was literally addicted to vaping. Now, I don't know that we really got into whether he was doing marijuana or it was just vaping. My impression was it was just vaping. But he literally got addicted to vaping. I think he started when he was 14 or something like that, getting his hands on stuff. So it's not just cigarettes, and it's including something that we know for a fact is having a bearing on these underage kids, and just want to get that on the record.
I kind of find it very difficult. What you said was that North Carolina doesn't have a list of tobacco retailers. There's a tobacco tax that's collected on everything they sell. That tax has to be reported to the state. So the state should have a list somewhere of who's selling tobacco in North Carolina.
Yeah, and I certainly for the tax record, I think because there's not a system in place right now for the surveying and the collecting that data, it's right now starting to be farmed out to an academic, as she indicated with the study. So I think certainly a list of where these are being sold could be compiled from tax records, but to have compliance for them to help us with research, if like in the ABC, you've also got a separate tracking system that entity could manage, so that there's not the communication between tax and what we need for data at this point.
Any other questions?
Would you like for me to read the resolution?
Would you please?
Yes, sir. Whereas 1 of every 5 deaths in North Carolina is associated with cigarette smoking, and for each death, 30 more people are sick or live with a disability. And whereas 95% of tobacco users start before the age of 21. And whereas as of 2019, 27.3% of high school students in North Carolina report tobacco use. E-cigarette use has significantly increased among youth since 2011. And whereas nicotine is harmful to developing brains, and its use during adolescence can disrupt the formation of brain circuits that control attention, learning, and susceptibility to addiction. And whereas in a 2020 study among North Carolina schools, a high proportion of school administrator and teacher respondents believe that e-cigarette use among students is somewhat or very problematic, reporting at 91%, and that student e-cigarette use is somewhat or a high priority issue for their school administration. And whereas most North Carolina young people obtain tobacco products, including e-cigarettes, from retailers, North Carolina young people who get e-cigarettes from friends primarily get them from friends who are under 21. And whereas in 2019, Congress increased the federal minimum legal sales age of all tobacco products, including e-cigarettes, from 18 to 21, while a majority of states, 41 states as of September 2022, have increased their minimum tobacco sales age to 21 to match federal law, North Carolina's minimum sales age remains 18. And whereas having the same legal sales age at 21 for alcohol and tobacco products reduces the burden on retailers, and whereas North Carolina is one of only 10 states in the country that do not require tobacco retailers to obtain a license or permit, and whereas North Carolina ABC Commission is capable of implementing an efficient and effective tobacco retailer permitting system based on the system also in place for alcohol retailer permitting, and whereas establishing a retailer permitting system and raising the minimum legal sale age to 21 will allow the state to know where tobacco products are being sold, improve merchant education efforts, allow the state to inspect for responsible retail practices, protect law-abiding retailers by holding non-compliant retailers accountable, prevent and reduce youth use of highly addictive nicotine products, help eliminate the use of e-cigarette and other emerging nicotine products in schools, and reduce any confusion among retailers and consumers by having one legal sales age for state and federal law. And whereas under the federal SINAR law, states are expected to reduce the illegal sale of tobacco products to individuals under the age of 21, North Carolina could lose over $4 million in annual funding from the Substance Abuse Prevention and Treatment Block Grant money North Carolina uses to pay for drug treatment, through penalties under the federal SINAR amendment if sales to underage youth are too high and required annual inspections. And whereas current North Carolina law, General Statute 14-313, preempts local authority to adopt evidence-based regulations regarding the sale, distribution, display, and promotion of tobacco products, this preemption should be removed to allow local governments to protect minors. And now, therefore, be it resolved that we, the Dare County Board of Commissioners, strongly supports that North Carolina must protect our kids from vaping and nicotine addiction by establishing a tobacco retailer permitting system, raising the minimum age of sales from 18 to 21, restoring local authority, and adopting other needed provisions of legal sales of tobacco products to match federal law.
Motion to approve resolution.
Okay, there's a motion on the floor by Commissioner Bateman to approve the resolution as presented, and it was seconded by the Vice Chair and Commissioner Couch. Any further discussion?
I have a question.
Yes.
One of the statements says, we are one of 10 states in the country that don't require retailers to obtain a license. Does that also mean that the other 40 states have all enforced or established the age of 21? Because down below that, you say a permit system and, all in caps, raising the legal age to 21. There are two different things.
Right. So 41 states have the
licensing.
40 states have the licensing and 41 have the tobacco 21 law.
Okay.
So there's one off.
Okay. Thank you.
Any further questions? Hearing none, those in favor of the motion on the floor signify by saying aye.
Aye.
Opposed,
No.
like sign?
No.
Let the record reflect, 1, 2, 3, 4, 5 yeas, 1 nay.
May I speak, sir?
Yes, sir.
My vote is not to encourage kids to use tobacco. You guys understand that, don't you?
Yes.
Okay. How many, I don't equate a fifth of scotch to a cigar. I've met a lot of 20-year-olds, some in the military, and quite frankly, I don't see children. I see some pretty darn brave adults, many in our own military. And number three, the hypocrisy of we will, as a federal government, withhold funding to you if you don't restrict that cigar sale to that person. But we will completely look the other way when you broad-scale use marijuana, permit it, allow it, wink and nod as you walk by it. I'm sorry, guys, it infuriates me. A comprehensive, serious approach, yes, I'm on board. I really am. But easy way out, no, I'm done. That's why I said no. Thank you.
Thank you very much. Thank you.
County Manager?
Yes, sir, Mr. Chairman. That brings us to items 10 and 11. Those are both dredge projects, and Barton Grover's here to present both of those. And item 9, just so you know, was pulled from the agenda.
Yeah, it was pulled.
Good morning. So you'll see Island H is back up in front of you. There's for two reasons. One, since we originally started the project, the state cost share went from 66% to 75%. So we'd like to take advantage of that new cost share, which we would need a new resolution for. The other one is both the Corps of Engineers and Coastal Protection Engineering found some issues with the slope stability. Essentially, over the last 10 years, if you've gone by that island, you'll see there's been some erosion of the sides, and they've ran some slope stability tests and determined that if you pumped it full of dredge material, it could cause a blowout. So it's something that will need to be fixed for Wanchese, the channel outer Wanchese, to be dredged. Essentially riprap, combination of riprap and fill. And also, I wanted to note, I didn't note in here in the description, we do have in Dare County budget in the fund balance and reserve, we have over $1 million for projects such as this with state cost share. That's about $4.5 million that we have, just so you all know where we are with that. But so essentially what I'm asking for Island H is for you all to adopt the resolution and authorize the county manager to execute the necessary budget amendment when we are awarded funds.
Okay.
Barton, just for clarification, it said sound side, so I'm assuming, I know there's some riprap along that, what would that be, western side of the island there. Is that where the work needs to occur?
Just to, if you're looking at that image, I know it's probably on landscape for you all, but just to the north of that bottom left side where you can kind of see it kind of curves in a little bit, it's right near the riprap. So essentially the riprap needs to be extended. It's suffered erosion since the last.
Extended outward or vertically?
Just extended to the north, essentially, along that shoreline
of the island.
Yeah, only like the southwest corner is riprapped. So essentially they need to go farther north. That project was done back in, I think, want to say like 2004. It was like a $2 million project to do riprap along that southwest corner because of that erosion issue.
Okay, thank you. Thanks.
Gotcha.
And and essentially this is creating capacity for the material for the channel that runs straight out from Wanchese. They will be doing another pipeline dredging project next winter west of Oregon Inlet Bridge to open up that alternate channel, and then also up in Wanchese.
So will the amount of the work that's done there just be enough to take care of the current dredging need?
Yes.
Or will it be done enough to take care of it in the future as well?
This is the last go for Island H. We're going to have to find another location moving forward.
Gotcha.
County Manager, would you read that resolution, please?
Sure. This is a resolution to sponsor the Island H modification project, whereas Dare County desires to sponsor the Island H modifications project to prepare the confined disposal facility for the upcoming U.S. Army Corps of Engineers dredging project. Therefore, be it resolved, Dare County requests the state of North Carolina provide financial assistance to Dare County for the Island H modifications project in the amount of $375,000 or 75% of the project, whichever is the lesser amount. Dare County assumes full obligation for payment of the balance of the project cost. Dare County will obtain all necessary state and federal permits. Dare County will comply with all applicable laws governing the award of contracts and the expenditure of public funds by local governments. Dare County will supervise construction of the project to assure compliance with permit conditions and to assure safe and proper construction according to approved plans and specifications. Dare County will obtain appropriate easements, rights of way, or suitable dredge material disposal areas that may be necessary for the construction and operation of the project without cost or obligation to the state. Dare County will ensure the project is open for use by the public on an equal basis with limited restrictions, if any, on public property. Dare County will hold the state harmless from any damage that may result from the construction, operation, and maintenance of the project. Dare County accepts responsibility for the operation and maintenance of the completed project. This is the 6th day of February 2023.
Move to approve.
Motion on the floor by Commissioner House to approve, seconded by Commissioner Bateman. Any further discussion? Hearing none, those in favor of the motion signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous. Thank you, Barton.
Thank you. So the next one is Avon Harbor. That's another one that the Corps received funding for through the AJA bill. They received $1.6 million for dredging. Again, that only is for dredging. It is on Dare County to provide disposal facilities, just like Island H. In Avon, there's no existing facility to improve, again, like we have in Island H. So we've talked with the Park Service, DOT, and the Corps. And essentially, we've looked at trucking the material from Avon Harbor that is dredged by the Corps and trucking it to Canadian Hole, Haulover, Kite Point, that area, and essentially doing a Soundside beach nourishment project, which would also protect the power lines and our water line, and obviously for DOT, protect the Route 12 where it's eroding right there.
Has recreational value as well.
Yes, and also provide, a lot of kiteboarders and people are driving along that beach also. So kind of beneficial reuse for multiple purposes. Essentially, the first thing they'll kind of make a decision on this project is there need to be some vibrocore sampling from Avon Harbor to make sure there's no heavy metals, RCRA 8 testing, and also petroleum, because obviously this will be placed on a beach that is used by the public. So that is the first hurdle. If the vibrocore sampling comes back bad, we'll have to kind of reassess this project. But essentially the other item which we would need funding for is trucking. DOT will handle permitting. They will also use their employees to push the sand out, do the beach nourishment, but we would need to fund the trucking from Avon Harbor to the Haulover area, which is what this shallow draft application would help pay for.
Barton, is that purple area where the fill is going to be put?
Yeah, so DOT made these maps. They're submitted to all the agencies for review. The purple area is the maximum extent of material that we would place, and that's, you can see the Haulover parking lot. That's on map 1, and then map 2 is just south of the Kite Point parking lot. That is maximum extent. That's if we did about 25,000 cubic yards at 2 feet. I wouldn't expect us to do that much material. That's a really significant amount of trucking. But that is what we're going to permit the maximum. I would assume we're going to have somewhere in the range of 15 to 20,000 cubic yards that we'll be placing down there.
Gotcha. There's a resolution that we need to look at, County Manager.
Sure, this is a resolution to sponsor the Avon dredging project. Whereas Dare County desires to sponsor the Avon Harbor dredging project to perform vibrocore sampling and trucking for the upcoming U.S. Army Corps of Engineers dredging project. Therefore, be it resolved that Dare County requests the state of North Carolina to provide financial assistance to Dare County for the Avon Harbor dredging project in the amount of $120,000 or 75% of the project cost, whichever is the lesser amount. Dare County assumes full obligation for payment of the balance of project cost. Dare County will obtain all necessary state and federal permits. Dare County will comply with all applicable laws governing the award of contracts and the expenditure of public funds by local governments. Dare County will supervise construction of the project to assure compliance with permit conditions and to assure safe and proper construction according to approved plans and specifications. Dare County will obtain appropriate easements, rights of way, or suitable dredge material disposal areas that may be necessary for the construction and operation of the project without cost or obligation to the state. Dare County will ensure that the project is open for use by the public on an equal basis with limited restrictions if on public property. Dare County will hold the state harmless from any damages that may result from the construction, operation, and maintenance of the project. Dare County accepts responsibility for the operation and maintenance of the completed project. This is the 6th day of February 2023.
So moved.
There's a motion on the floor by Commissioner Couch. It's been seconded by Commissioner Bateman. Further discussion? Hearing none, those in favor signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.
Thank you.
Thank you, Barton.
Thank you. And just some news, MedFlight just left Hatters today. They did 10 days of dredging down there in the connector channel down the Hatters. So,
Did you see the survey from EJE?
no, I have not.
It's
yet.
impressive.
I've got a full report on it.
Okay. Yep.
Great. Good deal.
Yep.
Thank you,
Good one.
Barton.
Thank you.
We're going to take a 5-minute recess. I'll call the Dare County Board of Commissioners back to order. County Manager.
Yes, sir, Mr. Chairman. We're at item 12 on the agenda, and this is an MOU between us and the school system for use of the first flight fields. In a couple of our workshops and a couple of meetings previous to this, we talked about lighting those fields to create basically 2 3/4 fields. It'll hold 2 full soccer fields and about 3/4 of another one in the area that is outlined in blue in your packet. And you all have money in the budget set aside to light that field, and we're moving forward with that process. However, before we spent the money, we wanted to be sure that we had an agreement in place that allowed us to use the field. And that agreement that you have in front of you has been through the school board. They have approved it, and it's here before you to approve. There's one thing that requires that I don't have yet that we will need, and that's the schedule of school uses, because it is a school, and the school does get first priority for use of the facilities there. And we wanted to be sure that what they prioritize as the use doesn't go to the length that it prevents us from using it for the rec purposes, which is why we're spending the money to put the lights there to start with. I don't think that it does, but I don't have that schedule yet. So you're approving this, and should that schedule come in something that, doesn't allow enough use to make it worth spending the money for the lights, I'll come back to you, but otherwise, we're gonna move forward
Okay,
with this.
so you got it. That's
Yeah.
good, Bobby. Thank you.
Tim assures me it's not a problem. They've all said it's the same thing that we've been doing, only the lights will add more time.
Is there a reason we haven't gotten that response back from the school?
Probably because it's coming from the principals, and they've got a lot of other things going on that are more important than getting me a schedule when they're gonna have field day or something.
Okay.
Yeah, so, but anyway, this is before you. Again, it outlines the responsibilities and allows us to move forward and provide some more rec space. The 2 baseball fields you see on there are there now. The one in the top, in the furthest away from the schools, is a regular sized baseball field. It can be played for the older kids. I think the 15-year-old leagues can play there. The one closer to the school is really a softball-sized field, but some of the smaller leagues could play baseball there as well. Those fields are okay. They can be played on. They do need some TLC. They need some paint. They need some fence repairs. They need some of the clay aligned and graded, and just some things we can do in-house with our staff to make them more playable, but they're there. In the long run, they're going to need some bleachers. They don't have bleachers especially on the backfield, and if we get enough play and the middle school uses it and those kind of things, and there's going to be, at some point, we're going to need bleachers back there. We can repair the fence now, but the fence is going to need to be replaced at some point in the future. And so there's going to be some tender love and care that needs to be done out there. If we get the kind of use out there that we expect, there's one building on that property now that is a concession stand storage kind of, it maybe even have a bathroom in it. I'm not sure if
It has a bathroom.
has a bathroom in it.
That was donated by the Visitors Bureau.
Right, but it's probably inadequate if we get the kind of use that we expect there. Certainly inadequate for all the storage that we might need out there, and likely inadequate for bathrooms as well. And so that's something that in the future we're going to need to look at, either replacing or enlarging or adding or something out there to make that more user-friendly. Before we start investing those kind of monies, we just wanted to get schedule straight, see what the demands are, see what the use is, and then we'll adjust the other amenities we might need based on those uses. So again, all this does now is let us move forward, and all that we're doing currently is the lighting project.
When were these photos taken?
I don't know, they came off of GIS, I don't remember.
Well, if you look at the second photograph, the field at the very bottom, on the right-hand side where the parking lot is, there are bleachers there.
Okay.
There's one set of bleachers there.
Yeah, I think those are the portable bleachers that.
Yeah.
Yeah.
And then if you go up further where that restroom and concessions are, that was donated by the Vistas Bureau. It's been in use in recent months because I saw them out there with concessions. But it does have restrooms and all in there, so.
What this is going to do is it's going to expand the field use programs, and that's going to be soccer, lacrosse, whatever. It'll give us, again, 2 3/4 of a field to try to meet some of that demand that you've heard about from the parents that have come in. It makes these 2 fields more usable and available. There are some parking issues. Now, I'll tell you, current time it's not used, when it's not used, people drive along the fire lane and park wherever they park, on the grass, in the field, on the road. This agreement, and the school wanted it this way, keeps people off of that fire lane, and so they're gonna have to park in that parking lot to the right where you see the bus. That's a bus parking lot between the 2 schools, or either out in the front lot and walk around, but they're not gonna be allowed to drive around behind the school, and park along that fire lane.
Reasonable.
Yep.
Yep. So with that said, if there's any questions.
All right.
Motion to approve.
All right, there's a motion on the floor to approve by Commissioner Ross. It's been seconded by Commissioner Bateman.
Bobby, I got a question. Is this something that we want to look at for Hatteras too?
I guess there is a concern at the moment that we're aware of that just came out this week.
Yeah.
About some needs down on the soccer area down there and with some of the facilities down there. I was talking to Commissioner Couch about that this morning. I said I don't really know what the request is and what the scope of what they need is, and asked him if he could set up a meeting with me and him and any of you all that wanted to go, members of the school board and whoever else are stakeholders. Let's go down there and take a look, see what we got, see what we need, those kind of things, so that we can make some decisions on that. And hopefully we can do that in the short term so that when we get into our workshops with the budget, we can talk about that as well.
And we can see how this goes, see how well it works.
Yeah.
And just since you brought it up, that's Hatteras. There's an agreement similar to this floating around that I haven't gotten back yet for the Kitty Hawk schools. That's less of an agreement between us and the schools, although the schools are involved in it, than it is an agreement between us and the league. We got to set some parameters about what our responsibilities are and their responsibilities are, so that we're not at cross purposes and we're not doing things or they're not doing things that interfere with the upkeep of the field. So that's out there. I don't have it back yet, but that should be coming to you in one of the next meetings.
Okay, there's a motion on the floor to approve the memorandum of understanding with the school board and authorize the county manager to sign the MOU. Those in favor of the motion signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.
Item 13 is the audit contract for fiscal year 2023, and I'll turn that over to Dave.
Morning, Dave.
Good morning. This item, the audit committee met in December, I believe, and we discussed whether to do a new request for proposals or to renew with Potter and Company. And the audit committee's recommendation was to enter into the new 4-year agreement with Potter and Company, mostly based on their performance and their fee level. And it's honestly not a good market to be going out for RFP right now. There's a couple of the big firms one of the local firms is not doing local government audits anymore starting this year. And one of the big ones out of Raleigh, Elliott Davis, said they're not doing any more either. So the market's kind of tight. What we agreed to with Potter was a renewal for 4 years at an annual increase of 3%. That would take the audit fee to $72,100, which is a 3% increase from 22, and this is for 23. Now, I found on the Local Government Commission website the handout that Cheryl just gave you, and this is only the first 2 pages in order of audit fee going down. There's 5 or 6 pages, and Dare County's in the middle of the second page, maybe a couple of lines down. These are both 22 and 21 fees. We're around 36th out of 100 counties. This is only counties. It is related to size of your budget, size of your financials, but it's also related, it's interesting, there's a lot of decreases in 22 numbers from 21s, and I ask, and it's related to what places did with their American Rescue Plan money and how much work had to be done for that. The more complicated you made it, the more the auditors had to work. So again, ours is reasonably in the pack, and I'm not going to name any names, but there's a couple in there that are significantly smaller than us because it also, that are higher dollar, because it also has a lot to do with the quality of the materials and the data and the statements you're given to the auditor for them to work with. So our request is to approve the contract, which is in your packet, and authorize the chairman and Commissioner Ross as chairman of the audit committee to execute that contract. And I should have said also the engagement letter that's in there.
Why is Dare on here twice?
It's both 21 and 22.
I see now.
And there's a lot of 22s missing on this list because they haven't turned in their audits yet.
I'll just add to that. I was at the county commissioner conference and had dinner with a bunch of county managers, and I was so proud of what we do because they were all fussing about how they can't get their audits done. They can't get them in time. Some of them are on the treasurer's audit list because they can't get the audits in by December and all that. And they asked me, I said, well, we don't have a problem with that. And they said, well, who's your auditor? I said, I'm not telling you. So, so we're good.
Right.
On that note, I move to approve proprietary.
Second.
There's a motion on the floor by Commissioner Couch. It's been seconded by Commissioner Ross. Any further discussion? Hearing none, those in favor signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.
Dave, just a question regarding audits, because I couldn't do one if my life depended on it. But when we have Potter year after year, is there any carryover in terms of, say, it being easier for Potter to continue doing it versus somebody brand new coming in and starting from scratch, more or less?
Yes, sir. There's big training. There's a big level of training and learning whenever you start a new audit. And I'll tell you experience. When I did the audit of the city of Charlotte in '88, the firm costed out $220-some thousand worth of time, and in '89 it was $125. That's how much the learning curve.
Wow.
So there is.
Gotcha.
And retention of the same people on the staff is related to that, so it definitely is.
Gotcha.
Okay, I am also item number 14. This is EMS project budgets, but this has nothing to do with the 3 projects you're about to hear about. That's the next items on your agenda. When we first started this and we hired Oakley Collier to start designing all the projects and working on all the projects, we budgeted everything in one because we didn't know in one set of project number, or one project number, I should say. We didn't know what was going to be in phase 1 or phase 2 or phase 3. This is to split those budgets out into phase 1, into phase 2, and into phase 3. And it is $713,602 less than what we originally budgeted because a good part of that is the Manio Youth Center. When we purchased that property, we also had money in that purchase budget for renovations. We paid architect fees out of that money. So going forward, the architect fees won't be included in the Manual Youth Center budget. And we've only budgeted what's been paid for the Phase 3 projects, which was mainly a design of the Rodancy station, and that was $332,932. And the one thing I wanted to note is that the architect fees listed in Phase 2 and Phase 3 are incurred. So if by chance those projects, it's not an issue if they get delayed, but if we cancel them, then we'll have to cover them through cash out of the capital investment fund. But that's just something to be aware of. So your request is to adopt the amendment to the project ordinance that's included in the packet.
Any questions today?
Yeah, just again, we're just reducing because of the different pot of money that the youth center came from. Otherwise, it's the same approval in
That's
three
right.
pieces. Okay.
That's exactly
thanks.
right.
Yeah. Motion to approve.
Okay, motion on the floor by Commissioner Ross to approve. Is there a second?
Second.
Seconded by Commissioner House and the Vice Chairman. Any further discussion? Hearing none. Those in favor of the motion signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous. Thank you, Dave.
Mr. Chairman, next on the agenda is the EMS projects, the Capital Improvement Planning Committee report. It'll be a request for approval based on their recommendations. At our Capital Improvement Committee meeting, we looked at a number of our projects. We had three that were in our first phase. We had the Southern Shores EMS, we had the DARE MedFlight, and we had KDH Station 1. Because of a number of things, the KDH Station 1 bidding got postponed. One was because Kill Devil Hills made some changes like the week of the bidding, which meant that we couldn't submit the bids because we had to go back and figure out how to make the changes that they had requested, and that delayed everything. And then that put some pressure on the bidders to get bids back on time. Long and the short of it, that has just gone out to bid, or is about to go out to bid. February the 8th, we opened the last of those bids on the Kill Devil Hill Station. So what we have ready to move on right now is the Southern Shores EMS Station and the DARE MedFlight hangar. We went through a bunch of the financials with the Capital Improvement Committee. I'm going to give you the shorthand version, and if you all want a little deeper dive, Dave can come in and give you more of the detail. But the long and the short of it is that our prices have gone up significantly from when we started. On the Southern Shore Station, they've probably gone up approaching 40%. And so it's a pretty big number.
Just to call out, guys, they had to resuscitate me twice during the CIP meeting. The costs, I'm serious, they have gone, it's staggering. It is truly staggering.
But that station, the cost of that's going to be roughly, I think, $8.5 million for that station, what we're trying to do there. Similarly, and that's kind of the outlier. I mean, that went up a lot. When we look back over here at DARE MedFlight, we can be relieved because it only went up 23%.
And I was worried for a minute.
That was a Rob moment there. And that structure is going to cost us about $9.4 million. I guess Kill Devil Hill Station 1, we don't have the bids in yet. You all had gotten an email, I think, that some of the bids we could open for the subs, some we didn't get enough bids and had to rebid. So we don't have a final number there yet. So far, so good, and we'll just see what happens, and we'll be coming back to you on the Station 1 project. The bad news is the price went up. The good news is because of the way the economy's performed, the amount of money we have sitting in our financial plan, all of those things. We've talked about coverage ratios a number of times, and that means how much money you have setting aside to cover your debt service over time, and you're trying to keep that above 1, I think. Is that right, Dave? Above 1. As we go through looking at these coverage ratios, we can meet that for the most part throughout these things. I think it gets down under one set of estimates to 0.69. Is that right? In the yellow here? No. It's the far right. So, yeah, so we're keeping it above 1. In 2029, it gets down to 0.99, so that's right at 1. But other than that, the coverage ratios can be held even with these increased amounts, and we have the funding available to fund these projects. With that said, when we get into the budget time with assuming that you all approve these today, these are the priority projects, if you will. If we didn't do anything else, these are the ones we need to do. Then we would move forward with these. When we start looking at the other projects that we've got out here, the remainder of the EMS stations that we either got to build new or replace, the public works facilities,
Right.
the youth center, all of those things. By the time we have our budget meetings and start looking at the CIP as a board, Dave and I will have worked through some of those numbers to see what available funds we can have, how can we do it, what kind of timing can we do it on. And it may require you all to come back and reprioritize those projects to get them in line with the availability of our funds. And so we'll just we don't know yet what that's going to be. We don't know yet how we're going to do that, but we'll come back to you with a plan. We'll tell you what we think our priorities are from staff level. You may disagree. They may not be the priorities that you think they are. And if they're not, then we'll rearrange them. But so be aware that we're going to, the CIP isn't going to be we're going to show it to you and it all works and you all approve it like it's been in the past. We're going to have to make some decisions and give it some thought, I think, unless we're pleasantly surprised with our revenue numbers. But that's where we are. So for today, the Capital Improvement Committee has recommended that we move forward with these two projects and ask you all to approve that as well. If you have questions, let me know. And if I can't answer them, then Dave's here. He'll answer them for you.
Okay. I've got one question. Even in Barnhill's letter, it states that, postponing the Kildover Hills was necessary. We understand that. But they also said that they found numerous key subcontractors were only interested in bidding the two smaller projects in conjunction with the larger KDH project. And this ultimately led to major bid packages such as framing, mechanical, plumbing, and electrical to receive less than 3 bidders, or this could be defined as unintended consequences or unfortunately a lesson learned. So I'm wondering if one of the reasons why these 2 buildings have increased in cost is because now they can't cover it with 3 buildings, they have to do it in 2.
Good question, and the question was asked, and we talked about that. But the long and the short is they're struggling to get bidders. I'm going to pick a random one.
I'm well aware.
The brick masons.
Yeah.
They're not getting any local participation in the bidding. So you're bringing in a bunch of brick masons. Well, when you bring them in from somewhere else, they got to have somewhere to live. So now they're having to rent space somewhere to put the brick masons. Well, we're paying for that, and so that lack of bidders across multiple disciplines is costing us money. You tack on top of that, the inflation and the cost of things, and then you tack on pent-up demand. The bidders kind of have their choice of the project, and they'll say, well, I got all this work out here, and if you want me, I might come to Dare County if you'll pay me this. Otherwise, I can stay home and work in somewhere else. And so we're paying the price for a busy economy, and it's not something we control. Dave and Dustin and I had a conversation with them about postponing all the projects and bidding them together with the Kildover Hills project. The problem is you start missing the windows for other bids, and then you may well increase them yet further. So you're rolling the dice. We said, let's don't roll the dice. Let's go ahead and get something on the table so we can get going. And so that's why we are where we are.
Right. And we had mentioned as a board before that we knew that we were kind of looking at, when Kildover Hills decided to change their aspect of it, we knew it was going to cost us a little bit more. And this is just one prime example. If it's going to cost
the Kildover Hills isn't in this.
I understand. That's what I'm saying.
Yeah.
A lot of the contractors wanted to bid all 3 buildings at one time, and now they can't do that, so they only bid on the 2. Instead of spreading their labor costs around all 3, now they've only got to spread it through 2. And that's
Yeah,
probably.
maybe. Yeah, yeah.
And I'm saying, that's one of the reasons why we're seeing a 23 and 40% increase in these. I mean, it's just one of several reasons, but one main reason is for that.
The only other thing I would add to that is at the same conference where I was with those other county managers having dinner, one of them's building a community college, and one of them's, they're building stuff too. And their numbers are reflecting ours. I said, what is your cost per square foot?
yeah.
And their cost per square foot, we're tracking our cost per square foot. And which, I guess, it didn't make me feel better that we got to pay this much, but it made me feel better that we're really not an outlier necessarily.
Right.
So.
Pop quiz, guys. What do you think the square footage cost is for the Dare MedFlight hangar?
$450?
No.
Steve?
I hadn't really got into that part of it.
And I'm not trying to trick you.
Yeah.
$650 a foot.
Yeah. And they're telling me they're paying $500 or $600 a foot for the stuff they're doing too, so.
$650 a foot.
Yeah.
Wow.
Well, some of the other things I noticed on,
There are guys leaving the drug trade to get into construction. It's more lucrative.
when you break it down a little bit, in SSD 16 and MFD 6, it talks about using sand as a structure fill in place of stone underneath the slabs.
Which facility are you speaking
That's
to?
on both of them.
Okay,
Southern Shores and the MedFlight. If you look at EMS Station 1, and I know that's an old building, don't get me wrong, but then that slab was built right straight on sand, and there is a hollow spot underneath that. Now, I know when building a fire station, I know it's a little bit different. Fire trucks are heavier, but also you have the same vibrations that those ambulances going in and out. I'm wondering if that's a good idea. I know we're trying to cut costs a little bit, but I'm looking at the long-term maintenance of the building, and we're talking about our foundation.
and which one was it, SSD what?
16.
SSD 16 and MFD 6.
What we'll do is we'll go back to them and see,
Guys, it's $9,000.
It's 20 grand for the two.
yeah,
Yeah.
We already did and discussed it with Barnhill and Oakley Collier, and they're both comfortable with it. They felt with the thickness of the slabs and the rebar and the compaction around it, that they are comfortable with it, and that's why they're recommending it as a VE item. I mean, you're right, it's in the total amount of things, it is not a lot of dollars.
Right.
20 grand.
Yeah, I know. I'm looking at, but I'm also looking at, 30, 40 years down the road when that building's still there. Is it going to be a problem then?
One thing we can do is, and I'm going to cover in my next items, is there's a lot of estimates in here still of our cost, and we will be back to you to change these budgets so we can have further discussions with Barnhill.
Ain't no doubt. That ain't no doubt.
Yeah,
I knew
yeah.
that would happen.
Yeah. And I mean, I know I'm nitpicking. I
no,
get,
go ahead, we
I
need
get
to do
that.
it now.
But SSD 15, switching from fiberglass external doors to metal. Again, that's a maintenance thing that later on, how many times we're going to have to replace those metal doors as opposed to a fiberglass door.
The exterior doors.
And
I know
that's a
Tim Oakley
$10,000
talked about
cost.
that during the
So are
meeting,
we going to save that $10,000 over the length of the building, or we're going to have
we'll
to
ask.
replace the doors? Also, floating floor is definitely a lot easier to maintain or replace a partial floor that's been glued down. Which
Where
is
are
in
you now?
SSD 14 and MFD 5. That's another thing I would kind of like to get some feedback on as well. SSD 12 is talking about switching the riser out to a check valve and have, instead of being plumbed through the wall, to have a 50-foot hose, and they're calling for a $400 savings. Whereas that 50-foot hose, I don't know if that's been added to it, but the 50-foot hose is about $250. So instead of saving 400, probably saving 200. And my other thing would be SSD 9. The Schedule 10 is thinner than the Schedule 40 for the sprinkler systems. And I'm wondering if that's a wet system or a dry system.
I don't know.
It's a wet system. So with a thinner line with water in it, is rust going to be, leakage going to be a problem sooner with Schedule 10 than it would be with Schedule 40? Exactly. So I'm looking at costs later on down the road. Just some of the things I ran across just by looking at it, and I'd like to have some input on those areas if we could.
So how do we want to, do we want to, I mean, we need to move forward.
Mm-hmm.
Well, we can.
So we'll move forward. I mean, what we'd ask you to do is approve moving forward. We'll have conversation with the architect, the engineer, the architect, the builder about these 3-5 items that you brought up. You know, it's not a lot of money. We'll see if it makes a difference.
I'm willing to move forward with this. I just want some more. Some more
I guess
feedback.
where I am is if they come back, let's just use the gravel and assure us, if the Kill Devil station's using a 4-inch, I'm making this up, 4 inches of concrete, doesn't have any rebar, we're using 6 inches of concrete and X-size rebar, that'll handle the compression of this, and this, you
Right.
don't need that, then I'm supposing we would move forward without doing the gravel. We just, we'll ask the questions.
Right.
If they tell us the useful life of a fiberglass door versus a metal door is the same, because the metal door will rust in 10 years, but the fiberglass door, the hinges are gonna break off in 10 years, then if it's a wash, then we move on. We'll ask those questions. If anything changes, we'll come back to you.
Yeah, I don't have a problem moving forward with it. I just
Okay.
kind of, just looking at the issues that are right in front, that were kind of raised flags for me.
Do you want to come back, do you all as a board want to come back and make the decision on these, or do you want us to take the recommendation, if they tell us the reasoning for it and the net effect is a wash, to accept their?
I'm fine with you taking their recommendation.
Okay, all right.
I'm not an engineer.
And there still are some pending other VE items that may pay for this stuff.
Right.
so.
Right, yeah.
All right, what's the pleasure of the board?
Move
then?
to approve.
Okay, there's a motion on the floor of Commissioner House to approve, adopt the amendment to the capital project and ordinance to authorize the county manager to execute the Barnhill contract amendments for GMP. Is there a second?
Second.
Seconded by Commissioner Bateman. Any further discussion? Hearing none, those in favor signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.
All right, and then there was one other item that came before the Capital Improvement Committee, and that was a request from the Tourism Board, and that was a request in connection with their desire to move forward with a event center over on the event site in Nags Head. It's something they've been working on for a while. They're at a point where they're trying to make a decision whether to go or not to go. The long and the short of it is, in order for them to move forward with that project is going to require us to help them financially with that in two ways. One is they're not authorized to borrow money. And so if at a bare minimum, we would have to borrow the money and then be the pass-through, to incur the debt for them to pay. The other issue is the way things are currently aligned there, they don't have a sufficient amount of cash flow over the term of a loan to cover the payback on that debt. And if we borrowed it, we would typically borrow it on a 20-year note. We would then charge them rent for what they can pay. And for us to get our money back with them paying at the rent rate, they'd have to be paying us rent for like 30 years, even though we would borrow the money for 20. And then during that 20 years, we would be paying payments that would start out in excess of $1 million a year, like $1.2 million or thereabouts a year, right there, $1.1 million a year, and then over the 20-year term, they would go down until the last year they would be in the $400,000 or $500,000 range. And so we would be incurring another liability that we would have to put into the capital improvement plan. You all don't have to make a decision today whether to do that or not. I think it's more appropriate for you all to make that decision when we look at the overall capital improvement plan, unless you all are of a mind this isn't something that we're prepared to do at all, then there's no reason for David and I to do all the work to try to figure out how to make it work if it's not something that makes sense to you all. But as we speak right now, adding another $1 million in debt service in addition to all the other stuff we got won't work in the time frame that we got. We would have to start spreading some things out and rearranging some things to plug this in. It would be about a $30 million debt to us. That would be what we're borrowing, and they'd be paying about half the payment on that. They'd pay half and we'd pay half, and that's where our $1 million or so a year would come in. So that's what they're asking. If they're going to do one, that's the only way they can do it. If you run their cash flows, they can't save enough money over any amount of time to take them 25 years to save that much money. So they're not going to be able to do it without an influx of money from somewhere, and so they've come to us for that. And so we had that discussion. Again, the Capital Improvement Committee didn't make a decision or didn't make a recommendation or anything. We just did the same presentation with a little more detail that I'm giving you, which I'm sure Dave can share with you if you want to.
And I'll know a whole lot more after tomorrow. I've got a meeting with our financial advisor about what I don't know about this and if there's any options we have for different structures.
Just to be clear, we don't know what that number is, Bobby. We did an estimate of the 30.
We did it now.
So their number, they were working off $20 million or $22 million, I think. And that was a number that was at least 2 years old. And I just arbitrarily said, man, there's no way you're doing this for under 30. And we picked 30 out of the sky. So it could be 35. I don't know what it is. It could be 28. But it's certainly not going to be 22 given our numbers and given they were using estimates that are more than a year old. So we knew that wasn't in line. So just to pick a number to talk from to give some idea what we're thinking about, we chose 30 just as a number off the number tree, if you will.
Well, in fairness to their request, I know it's a lot of work on y'all's part, but I'd like to see what the numbers are. You know, and I can talk about the pluses and minuses right now, but right now I'd like to see what it would do moving forward. We got 3 major projects, and I'd hate to see those timelines interrupted. So it would help to see what the numbers are, to see how what we've currently said we wanted to do and how that would play into interrupting what we have on the books now.
I agree.
So, so with that said, then we'll ask them to go to their architect or whoever gave them their number and give us some more current numbers. Whatever current number they give us, then Dave and I, as we work through the CIP for the upcoming budget, we'll work that in and say, okay, if you want to do this, here's what it looks like. If you want to do that, here's what it's like, and give you those choices. Or if you don't do it all, here's what it's going to look like, so that you'll have a way to make some decisions. Sure.
Let me just add a comment for those. I sat on a small committee for about 2 years that was leading up to this. We were using, and I'm not saying Bobby was wrong, I had 18 million in my mind, but for whatever it's worth, all of the financial models were losers operationally, okay? Every year it will lose money, and that was at the either 18 or 20. The justification was, if you will, the economic halo effect, the 20 or 25 or $30 million to the economy of bringing in the podiatrist convention or the pickleball championships of Eastern North Carolina or whatever it may be, and the subsequent renting of houses, hotel rooms, restaurants. The facility itself, though, if you took that cost now up to 30 or more, the operating loss would go from not good to worse. So just everybody.
But they also, I think they said, they gave us a number they could afford for debt service, and still operate. So our subsidy would be debt subsidy. It wouldn't be operational subsidy. I guess it's the same thing depending on how you write it down.
It's not going to change.
But nonetheless, if we subsidize the debt at the rate that they've requested, then they can stay in the black, if you will, operationally as well.
And the other comment was about the grants that they provided, those
Yeah,
community,
the
the
tag.
tag grants. Yeah.
Those tag grants would go away.
Ouch. So let me ask something, Bobby. So, and it might be a stupid question, but is there any way we could spend this to include it with the Parks and Rec capital improvement we have in 2028?
That's what we're gonna be doing.
That's what they'll be doing.
I mean, again, I'll use my number that we made up. We gotta figure out, if we put $30 million of additional debt, be it for whatever, in the capital improvement model that we have, absent any change in our projected fund balances and revenue sources, when can you do $30 million? How long a period do you need? It's not going to be 5 years. It's going to be, I'll make up something, 10 years or 8 years. And so now you got an 8 or 10 year window to spend that amount of money. Where do you put your projects in that 8 or 10 year window as you're spending that money? And then keep in the back of your mind, you got to leave some capacity in your model for something you don't even know about that could come along too. So a lot of decisions to be made, and you know, we can give you some idea what that looks like when we have some more information.
All right, thank you.
All right. We've been sending you, or Dustin has been sending you project updates. He's here. I don't know if you want to hear anything else. Are you all satisfied that you know where we are with the other projects? Nothing's changed since the last email he sent you, he told me, but he can certainly answer any questions. Come on up, Dustin.
Bring us in.
Morning, everyone.
Good morning, Dustin.
As County Manager just mentioned, not a lot has changed since the last email, and you all have discussed just about everything that's on my list of current ongoing projects today. So I'll keep this brief. If there are any specific questions as I go through this, please stop me and let me know, and I'll address those questions. Mania Youth Center, as Bobby just mentioned, the CIP met, and they made the recommendation to move forward with I guess projects Station 4 and Station 7 as they presented to you all, which we just discussed. Station 1, we bid the first 20 packages we were able to open. There's approximately 7 of them that we weren't able to open. Those 7, unfortunately, are probably going to be the overall budget, about half of the building. They opened February the 8th. Barnhill will have a GMP back to Dare County by February the 15th, which is the time frame we all need to make sure all these stakeholders can go through their approval processes. Affordable housing, I believe it was the December meeting, you all authorized the county manager to close on 803 Bernice Avenue, and as I understand, that's still ongoing. There's some land at the Kitty Hawk area that's still under discussion from Coastal Affordable Housing, if that's going to be suitable for a project. Kitty Hawk Ball Field.
Before we leave that.
Yes, sir.
There was a recent email, and I think we made note of some property in Mans Harbor, 5.5 acres or something. Has that made it to your list of?
No, sir, I'm not aware of that.
I've got it. Yes.
Okay, thank you. Go ahead, sorry.
Kitty Hawk Ball Field, everything there is on track to be ready by the start of the season. The current contractor there is working on the dugouts, working on the concession stands. Everything will be, yes, sir.
Have they contacted the folks from Harris Teeter about doing the scoreboards?
No, sir, but I've asked about it and I've not got a response, but I'll follow back up. Tim White and I were working on that.
Did you say scoreboards?
Yeah, scoreboards aren't working
Oh,
properly.
I thought you
They're
said
having new
school
ones.
boards.
They're having new ones put in. The league has bought new
Harris
scoreboards.
Teeter was gonna pay for them.
You're still getting used to it.
Well, that's not what they told me. They said they had purchased them. If you look out there, they've already put the structures to mount them on. They've already put salt-treated pilings and heavy.
That's fantastic news.
Yeah.
But, just letting you know, the guy from the regional director from Harris Teeter called me, and I put him in touch with Tim. I thought maybe he's the one that paid for them. I don't know. But he was willing
The league was paying for those, right, Dustin?
That's correct.
Yeah.
I'll go back and see exactly where the
Babe Ruth League?
funding came from.
Them
I
things
don't,
are like $14,000.
They were
apiece.
12,000 apiece.
Okay.
They were 12,000 apiece, and they said total, and they said that they were gonna
Okay.
pay for the scoreboards.
Yeah, it doesn't matter as long as we got them.
Yeah,
yeah, new scoreboards will be put in.
yeah.
Yeah, and if they do, I mean, that's, when you and I were doing it back in the day, Pepsi did them.
Yeah.
Pepsi came in and put the scoreboard
Yeah.
in for free, and we had to serve Pepsis in the concession stand. I'm sure Harris Teeter may have.
So
a
it's
similar-
moving, something's happening because they've got the foundation of the pilings, salt-free pilings in for the scoreboards, on field one. I haven't checked field two, but I know they got them on field one already installed, ready to
Fantastic.
put the,
And
ready.
then, while we're on that, just so you all will know and won't be surprised, in the back of that field in Kitty Hawk, the field, is field one, the one,
Field one's the closest to the main highway.
well, then
Field
field
two's the
two,
one by the
the
bus.
one in the back.
Field two's in the back.
The one back by the water tower, there's a shed back there. You can see a green shed that's kind of run down and beat up. That's going to get gone.
Yep.
And as a part of the Southern Shores Fire Department project, we're going to build a bigger shed there that's going to store some of the Southern Shores equipment that was in the fire department that won't fit in the new fire department we're going to build. So we're building that for them, and then half of it or 25% of it
About 25% will go to
will
Parks
be
and Rec.
new storage for the rec league there, so they can have
Yeah,
a place to put
the
their.
main thing they keep in there is a lawnmower. That's that lawnmower, and they've got that padding that goes on the fence.
Well, there'll
They
be
usually have some of
pitching
that in there.
machines,
Pitching machines.
line machines, all
line
that
machines.
stuff that they use will go in that.
Instead of storing it in the bathroom, or the women's
Right.
bathroom, that
And this
needs
is-
to be in the shed.
And this is going to be built on a pad?
Yes, sir.
This
It'll
will
be
be on a
stick built on a
concrete
concrete
pad instead
slab.
of a wooden floor, so it'll be a much nicer building than what they got now.
Let me just ask you before we move on. All I know is what I read in the paper, but the pitch change on the roof at the youth center in town here was, what
That's
kind of
none.
impact was that?
None.
None, okay,
Inconsequential.
Zero.
all right.
Well, it was a
It
little
was
more,
more, it was more money, but it wasn't,
but it was like $5,000 or $6,000.
yeah, it wasn't any,
insignificant.
it didn't change the design or the look of the building.
Any other questions about the ball field or main youth center? So, first flight lighting project, as Bobby had mentioned, we're still waiting to hear from the school board as far as their schedule for that particular field. The reasons he mentioned today is kind of where we're at, not a standstill, but we're just waiting to hear back from them to make sure our needs and their needs will be met before we move forward with creating a purchase order to the lighting company. Dominion Power is still getting us some cost for that transformer box that's gonna have to go out there.
And on that, I talked to Dominion Power. I mean, that's a significant cost. That's like a $40,000 cost.
Yes, sir.
And I talked to them about potentially making some kind of a donation or trying to help out for the youth programs that are operating out there. I haven't heard back from them yet, but I told them we would put up a sign or we'd do something to recognize, their donation if they'd help us out there. So we'll see what comes of that as well.
Question?
Not on that, I just have at the end of your
Okay.
presentation.
Walker Park in Wanchese, another facility that needs a little bit of some TLC. There's the beginning of a depression being formed on the third base dugout line. Tim White, myself, and the facility maintenance staff have been out there. We've got some contractors that have agreed to do the work. We're going to remove the existing dugout, provide some fill, do the compaction test, bring the dugout back in, fix some of the fences that line that third base line, and that should all be ready to go by the start of the baseball season as well. Roanoke Island Drainage Project off of Airport Road. Yes,
Back
sir.
up, Dustin. How about the ball fields behind the schools? There was a couple of places on the backstop that needed patching or fixing. Is that included? They gonna get that done?
Tim said he's going, they're taking care of fixing those too, yes.
Okay.
And while we're on rec facilities, add the Hatteras plan that we talked about earlier in the meeting just to your list so that when we update after Danny sets up our meeting, then we can keep the board informed of that as well.
Placeholder, yeah.
Yep, sure. The Roanoke Island Drainage Project, everything there is going well. We're on schedule. Hatchell's started to mobilize equipment. Surveying crews have been out there. I've been in contact or attempted to contact all of the property owners that are adjacent to where the project's going to run through the new drainage ditch there. They're all aware of what's going on, kind of the timeline, the scope of the work, and when the contractor's expected to be in their general vicinity. Hatchell's going to work from the airport side upstream towards Airport Road, and they are expected to be done, estimated by around June the 1st. And Barton and I are working together to keep the Golden Leaf staff and their people informed so we can capture some of those grant funds. Upcoming projects, I'll add Burris Field and the Buxton project to what we need to do there.
No, what?
Well,
Burris?
this is the Weather Bureau.
This is down at
the
Weather
soccer
Station.
field.
Oh, by the soccer field.
Yeah,
Gotcha. Okay.
yeah.
Okay. I'll add that to my list. Island H that Barton was up here talking about to you all earlier, he and I are going to start coordinating on how we can get a contractor on board, just like we did when we were doing the digging, excavation of that. We'll have to hire a contractor to go out there and place the riprap, but that's standard procedure. Hazardous mitigation grant planning, that's been on my upcoming project list as well. The state construction office is handling some of that, and Bart and I are working alongside them, just waiting to get approval. The funds that we were given weren't adequate to cover a lot of the cost to elevate some of these homes, so Barton has gone back to the NC Emergency Management and or to FEMA to request some additional funding, and we're just waiting to hear back from that. And with that would be my project update. Is there any questions?
Super.
Commissioner Ross?
Tiny ones, and may not even hit your radar, Dustin. No, I'm serious. At the shelter, last year, we did a very nice fence enclosure for the shelter dogs to have a run, and it was going to include, I thought, a line to run water in there from the existing water line. And I checked about 2 or 3 weeks ago, and there was no update on it. And the second thing was walking from the shelter across the parking lot and down to where that fenced area is. There's a fairly significant swale ditch. And there was going to be a small, bridge, 6-8 feet wide, just to get over that so people don't stumble or fall or whatever.
Okay.
And I have no update on that either. And again, small items, I know, but just curious.
I'll follow up with Mr. Coleman over there to see, what his thoughts are, and if we need to get buildings and ground staff to build some sort of walkover,
We do. He'll confirm it, but
Yes, sir,
please do.
I will. I'll
Yeah.
follow up just to
Yeah,
make
you'll
sure
see
it's
it when you
wrapped.
go over there, Dustin.
Okay.
It's pretty obvious, yeah.
Okay, I'm
Coleman
sure.
and I were talking a few weeks ago about it, so. yeah.
Okay.
Have they shared that with Bill? I mean, is it something on our radar we haven't gotten to? Because I didn't know about either of these, so I may have known about the
He's
water.
mentioned Keith a number of times.
All right,
Whether
well, I'll
Keith
follow up,
is-
with- see where we are.
Yeah,
Okay.
Keith apparently is completely in the loop on that.
Okay.
Yep.
Yep.
Okay, thank you.
Yes,
Thanks,
sir.
Sis.
Any other questions or anything I can answer?
Thank you, Dustin.
All right,
Appreciate it.
thank you all.
All right, that brings us to item 16, and Dave will handle that. So this is the formal approval of what we've just spent a long time discussing, so I'll take that to you, Dave.
Did they vote on that?
Yeah, we did.
They voted to move
Yeah,
forward. Does that
yeah.
cover you?
Yeah, that covers 16.
Okay.
We're on 17.
All right.
Moving along.
Now, number 17 is how to pay for it. This is your first step in issuing bonds for Southern Shore Station, Dare MedFlight Station, and the joint Kittle Hill Station. Cheryl's given 2 handouts to you. One's just a calendar that we finished on Friday of when things are going to happen. The other is the numbers run that I got on Friday. The good news is rates have gone down since October, a little bit, the longer-term rates. So we've gone from looking at about a 5% bond issue to, as of Friday, their estimate's 327.
That's the good news. The
That's-
construction to build it's gone up
significant.
40% at the same time.
Um,
Honest to God, guys, the world
And
is
as
nuts.
far as those numbers go, you're going to be seeing an MOA or a local agreement with the town of Kittle Hills, and what they'll do is pay their share of the debt service to us every year. So we'll record that as a revenue in the capital fund that will offset part of our debt service cost. Actually, about 48% of the debt service cost. The other thing I wanted to mention is all the resolutions you're going to get and all the documents you're going to get, bond council's wording everything so that if we're under budget on MedFlight and we want to use the money on Southern Shores or Killable Hills, we can do that between all three projects. And we can also do with that with any projects coming in phase 2 or phase 3. Kind of not normal, but they got it done. The resolution you're going to be asked to adopt today is going to ask for, include a not to exceed amount of $49,250,000. That's just a safe if everything went wrong number, and it's more of if everything went wrong on the bond sale, because when you sell bonds, you either sell them at a discount, so you sell them for less than, we use $100, but you know, you'd sell them for less than the face amount of the bonds. That's a discount situation. Or you can sell them for more than the face amount of the bonds, which is a premium. If you have to sell at a premium, then you're hitting that not to exceed number. So we could, these include, for example, well, I don't have the not to exceed. Yeah, I do. The not to exceed numbers are, no, that's an old one, around 43 million, but if you had to sell bonds at 5% premium, that goes to about 48 million.
And please explain, why would we ever want to sell bonds at a premium?
Right now, the structure is at a discount. What most of the buyers are institutional buyers, insurance companies.
But what's
mutual
driving
funds.
that behavior?
They want 5% coupons. And our interest cost right now is estimated to be 327. So
You
to
guys
get us
following?
from
The interest paid on the
327
bond
to
face
5,
is
we
too low.
sell them. If it's a $5,000 bond, we'd sell it for $4,800. And those are just made up numbers, but it all depends on what the structure that the buyers want to have, and it's usually the interest amount on the bonds. So they want 5% bonds. Well, our interest rate, we're saying we should only pay 3.25%. So we're going to sell them less than 100 or less than $1 per dollar. And we get the benefit of it, and it's got to be amortized over 20 years and booked, and it gets messy, but it works. It works to get us down to our 327 in these numbers. At any rate, that not to exceed is so we don't have to come back and redo resolutions in case we end up in that number. It does authorize the county manager and myself to move forward on that, but we will not, you know, you'll have a public hearing and one more resolution and then the final approval. So you were in control of that process. It's not like we'll just go out and, you know, raise the amount.
Dave?
Yes, sir.
Is this going to be the same players, so to speak, that we have on the courthouse and other things on these bonds buyers? You talk about institutions.
Yeah.
All right.
Yeah, it will be. It will
Different
be.
numbers, but the same process and the same people.
Okay.
Right. The other thing involved is that the Killable Hills property is pledged as the collateral under the deed of trust. That should be sufficient. Everybody thinks that's sufficient, but you also give us give yourself and give us the flexibility that if we need to come in and pledge the Dare MedFlight property, or more likely Manio or Frisco or Mans Harbor, we can do that if we have to. But right now, just it affects the cost of the bonds, the good, you know, the wholeness of your security pledge. But you know, FA and bond counsel think we're okay right now. It also calls for a public hearing at your next meeting on March the 6th. We'll be on the LGC agenda for their approval on April the 4th. We've grabbed a sale date of April 20th, and we've changed the closing date to May 5th. So your resolution says it's in the best interest of the county to enter into a financing contract to finance the projects, and Killable Hills property will be pledged as the collateral. The projects are essential. The not to exceed amount is $49,250. The use of an installment financing contract is preferred and is more cost and time efficient. Any increase in property taxes, if any, will not be excessive, and there is no increase in property taxes needed using our debt affordability model. County's taxing power is not pledged. We're not in any debt default. Our budget process is in compliance with the Local Government Budget and Fiscal Control Act. In our past audits, the county's been in compliance. We've not been censured or had findings from the LGC, external auditors, or regulatory agencies. You'll have a public hearing on March 6th, and then you're authorizing the county manager and finance director to proceed with the contract in an amount not to exceed $49,250,000. You're directing the finance director or my designee to file an application with the Local Government Commission. You're authorizing and direct us to retain Parker Poe, Adams, and Bernstein as bond counsel, DEC and Associates as financial advisor, the Bank of New York Mellon Trust Company as our trustee, and Piper Sandler as the underwriter. And you're setting a public hearing on March 6th on the contract deed of trust of projects, and you're directing the clerk to the board to publish a notice of that at least 10 days prior to that public hearing. So our request is to adopt the resolution.
Thank you, David. Any questions today?
Just confirming that 25 million in Kill Devil Hills we only have half of it. We're doing the whole thing.
That's right.
But KDH is assuming half that cost will pay us rent, so that our true liability on this, although we hold the whole bond, our cost will be subsidized 50% through their rent.
That's
Yes.
right.
Okay.
And as far as I know, they don't have an answer yet, but they have gone to the Local Government Commission to see if Kill Devil Hills needs to go and apply for approval. Kind of our opinion that the answer is yes, but don't have answers back yet. So.
Move to approve the resolution.
Well, I'm not going to ask the county manager to read the resolution since David just outlined the whereases.
Thank you,
So the motion on the floor has been made by the vice chairman.
Second.
It's been seconded by Commissioner Bateman and Commissioner Ross. Any further discussions? Hearing none, those in favor signify by saying aye. Aye. Opposed, like sign. Motion carries unanimous. Thank you, David.
And just before we leave facilities, just two last things. We have a lease floating around with Kill Devil Hills to do what Commissioner Ross just said, to set up that arrangement. I don't know if there's any problems with it. They've seen the financials and all that stuff, and so I don't think there's anything there. I've talked to them about it, and I would expect to have that back pretty soon so that we can get all this stuff on the schedule that Dave's talking about. Similarly, we've been going around and around and around with the town of Southern Shore, not the town of Southern Shores, the Southern Shores Fire Department with their lease, and I thought I had it resolved, but I don't know if I do. I've asked to have an in-person meeting, hopefully this week with them to try to get that knocked out. If I do, depending on Dave's schedule, I mean, if we brought that on in March the 6th, would we be good? Okay, so we will have that on your next agenda, hopefully, so that you can approve that as well. With that, we'll move to item 18, and this is a resolution supporting step pay and compression increases for the Division of Juvenile Service, Justice and Delinquency Prevention, Secure Detention, Youth Development Center, and Court Services staff. And Commissioner House asked for this to be placed on the agenda.
Thank you, County Manager. As y'all are aware, I serve on the Juvenile Crime and Prevention Council, and I thank you again, Mr. Chairman, for that appointment to that council. One of the things that's come up is the juvenile justice program in the state of North Carolina is desperately underfunded. What has happened in the past few years is that our corrections and judicial system pretty much had adults and juveniles into one pot, and then recently they've separated. So the adults are on one side, juveniles are on the other side. And what has been kind of hurt with that is also the funding on the juvenile side. And as you all know, children are our most salvageable group. in the juvenile justice system. If we get the children, the juveniles with the proper counseling, we can turn their lives around and actually prevent further and more dangerous criminal activities later in life. For younger offenders, those under 18, the juvenile justice program is usually their first encounter with North Carolina law enforcement officers. Although some of the youngsters who break the law end up in the court system, juvenile justice offers other programs and services. For the first time event, it helps them mitigate the court system for the first time. Juvenile court counselors are the interface between the courts and the juveniles and their families. And at this time, we are have reached a critical shortage. Locally, we're struggling locally to attract and retain employees, not only here in Dare County, but also the juvenile detention centers across the state of North Carolina. It is our understanding there's 52% vacancies in staff across the state. And part of that is because of the pay structure, which has not been updated from the rest of the state. And also, if you look at a counselor who has to have a bachelor's degree and preferably a master's degree, they come straight out of college or even with a few years of experience at $35,000 to $37,000 a year. And coming out as a master's degree at $35,000 or $37,000 a year, when we all know through COA, you can go into HVAC and make more money than that as a technician. So what we're asking for is if we can adopt a resolution that the Junior Crime Prevention Council has already adopted, and I've already made contact with our state representatives and let them know that what the Juvenile Crime Prevention Council adopted this resolution, and I was hoping that this board could also adopt a resolution in support of it as well, and not only have it be sent to our local representatives, but also be sent to the House Appropriations Committee on Juvenile Justice and also the North Carolina Senate Committee on Juvenile Justice. And I'd like to make the motion to adopt. And County Manager, could you read that resolution for us?
Sure.
Please?
This is a resolution supporting step pay and compression increases for Division of Juvenile Justice and Delinquency Prevention, Secure Detention, Youth Development Center, and Court Services staff. Whereas the Division of Juvenile Justice and Delinquency Prevention provides secure confinement in juvenile detention centers and commitment services in the state's youth development centers that are essential to the protection of the community and rehabilitation of juveniles. And whereas the lack of adequate staffing constrains effective implementation of the therapeutic and rehabilitative model of care in the state's juvenile facilities. And whereas the Juvenile Crime Prevention councils are charged with ensuring the availability of appropriate dispositional alternatives up to and including confinement for justice-involved youth that are both therapeutic and conducive to rehabilitation. And whereas the staff within the state's juvenile facilities have been passed over for step pay plan and compression relief that would recognize and reward experience and make compensation more competitive, as well as ensure qualified staff recruitment and retention. And whereas the Division of Juvenile Justice and Delinquency Prevention is contending with an overwhelming vacancy rate, largely due to the impact of the pandemic, which has driven salaries and wages higher across the board. And whereas the step pay and compression relief for Division of Juvenile Justice and Delinquency Prevention facility staff and court services staff were removed from the state's budget prior to final approval. And whereas similar salary adjustments or increases were approved for the staff in the state's adult correctional facilities and community correction employees. Therefore, be it resolved that the Dare County Board of Commissioners supports the adequate and timely increase of the salaries of juvenile facility and court service staff across the state of North Carolina to make those positions competitive and to ensure qualified staff are compensated adequately for years of experience for the purposes of retention, as well as lay the groundwork for recruitment of qualified staff for youth facilities, which will ensure the immediate and ongoing protection of the community and strengthen rehabilitative services for those juveniles most in need. This the 6th day of February 2023.
As I mentioned, I would move to adopt the resolution.
Okay, there's a motion on the floor to adopt the resolution. Is there a second?
Second.
Seconded by the vice chairman. Floor is open for discussion. I've got one, Steve, just a curiosity from my part. They say they want to push for step pay. I understand that. Compression relief. Do you know how they define compression relief? Do they look at that from a COLA standpoint or
Yeah, from years of experience. That one position I was as a counselor between 35 and 37, that's your pay scale.
Right, but they also mentioned compression relief. I'm curious how they define that, just out of curiosity, because we fight compression with our county employees all the time. So,
right, and the rest of the state has that same problem, but they also have ways to move people through the pay scales. In the juvenile system, that has been overlooked.
Gotcha. Okay. Does anyone else? Those in favor of the motion signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.
Thank you, gentlemen.
Next, Mr. Chairman, is your consent agenda. On the consent agenda, you have the approval of the minutes from January 3rd and January 18th. You have the Monarch Beach Club of DARE lease renewal, you have the DHHS Community Child Protection Team and Child Facility Prevention Team annual report. You have the older adult fire alarm proposal. You have the Water Department NCDOT three-party right-of-way encroachment agreement, tax collector's report, update to the county financial policies and travel policy, capital project ordinance for the Frisco Buxton Pathway, capital project ordinance for the Soundside Boardwalk Improvements Project, and use and occupancy permit NCODOT/bridge project water line agreement.
Pleasure of the board.
Move to approve.
A motion on the floor by Commissioner House to approve the consent agenda as presented. Is there a second?
Second, yeah.
Seconded by the vice chair and Commissioner Ross. Any further discussion? Hearing none, those in favor signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.
Next are your board appointments. The first is the Senior Tar Heel Legislative Delegates. The terms of Kay White and Suzanne Kelly expire this month. They are both recommended for reappointment.
Move to reappoint.
Second.
There's a motion on the floor by the vice chair to reappoint. It's been seconded by Commissioner Couch, excuse me. Those in favor of the motion signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.
Next is the Aging Advisory Council for the Albemarle Commission. The terms of Brandy Bohannon and Kay White expire this month, and they both wish to be reappointed.
Move to reappoint.
There's a motion on the floor by Commissioner House to reappoint. Is it second?
Second.
Seconded by Commissioner Ross. Any further discussion? Hearing none, those in favor signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.
Next is the Community Child Protection Team, Child Fatality Prevention Team. Nancy Griffin is stepping down from that service, and Sarah Sampson is recommended to fill her vacancy.
Move to appoint Sampson.
There's a motion on the floor by Commissioner Couch to reappoint. It's been seconded by the Vice Chairman. Any further discussion? Hearing none, those in favor signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.
Next is the ABC Board.
Oh, excuse me.
Isn't there two on there?
There's two,
There's
right?
two.
We missed Stephen Burrett to replace Jeff Mitchell. That was in conjunction with Sarah Sampson.
Right.
Okay, that's not on my. Okay.
There's one more item, there's two.
Okay.
I'd like to amend that last motion to include Stephen Burrett to the Child Fatality Prevention Team.
Okay. There's a
And the
motion
DARE
to
County.
amend by Commissioner Ross. It's been seconded by Commissioner Bateman. Any further discussion? Hearing none, those in favor signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.
All right, and that then brings us to the ABC Board.
That's correct.
The ABC Board recommends for your selection the following applicants to fill the vacancy left by James Clark. They Pat Hudspeth, Don Twine Jr., Jimmy Pierce, and Michael Andrews.
Move to appoint Jimmy Pierce.
There's a motion on the floor by Vice Chairman Overman and Commissioner House to
Second.
appoint, and it's been seconded by Commissioner Bateman.
Before you vote, do you want to add to that and request the new member's term expire in August of 2023 to then be considered for reappointment in order to better stagger the terms?
Yes. Yes. Is makers of the motion and the second approve that?
Yes.
Second, yeah.
Okay. Those in favor of the motions and signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.
Next, you have your upcoming board and committee appointments. In March, you don't have any. In April, you have the Airport Authority with 1 term expiring, and the Mans Harbor Marine Commission with 4 terms expiring. In May, you have the Veterans Advisory Council with 2 terms expiring, and the Zoning Board of Adjustment for Dare County with 2 terms expiring. And with that, Mr. Chairman, that would be your agenda.
Thank you, County Manager. That brings us to item 21, and that's Commissioner's business and County Manager's business. County Manager?
Yes, sir. The only thing I have is the opioid settlement there's been another round of settlements coming, and we're going to be asked to adopt another resolution to approve that settlement. That's going to come here in the next few weeks, we would expect. There's a deadline for all the counties in the state to have to approve it so that you get 100% of the money. I don't know the splits yet, and I don't know the gross amount yet, but I do know that the split will be along the same lines as what we did with the state, that 85-15 before. I tell you that because we may be required to meet some of these deadlines to have some type of special meeting to get you all to approve that whenever that comes out, if it doesn't come out in sequence to hit our March meeting. So
Okay.
Just to be aware.
All right.
And I think, Commissioner House, you had a request as well. I don't know if you're going to do that on your business or do that now.
Whatever the pleasure of the board, we can do it now if you want to.
Sure.
Go ahead. You finished?
I'm
with your-
done, yes,
You
sir.
done? And then we'll move to County Commissioner's business, and I'll call on Mr. House first.
Thank you, Mr. Chairman. I was approached by Collington Fire Department with a situation that happened here there recently when they were cut off from the rest of the county because of flooding. They had a cardiac call and actually raised some concerns. Because they're one area that can definitely be cut off from our EMS system at times because of flooding in that area. They were requesting or trying to come up with ways to come up with the funding for the Lucas device. Several meetings ago, about a year or so ago, remember we had a demonstration from EMS here on using the Lucas device, which is a CPR machine that frees up manpower and actually provides the best CPR possible. And Collington Fire Department at times can respond to medical emergencies and be on scene several minutes before EMS can get there. And just in 2022, Collington Fire Department answered 493 medical calls, and in 2021, 571. So it's an ongoing situation with them that might have a lasting impact to our citizens in Collington, especially during the summer when EMS is busy, and also in times when the road is cut off due to flooding. So Collington Fire Department has asked if we could possibly extend some funding for them to actually purchase a Lucas device, and I have an invoice from them that they've looked at, which is $20,687.39. And I see this as a very positive thing for Collington to try to do. They're limited in what their funding is as a volunteer fire department, not only tax-based to a certain extent, but even to cover the shoestring budget they have, they also have to have private donations. And they were looking at possibly trying to do some type of a donation process to get this piece of equipment, but it would take quite some time to get through. And I think this is something that possibly we could take care of it for them. Plus, it'd be a device that we also have with our EMS system, so it'd be interchangeable. So I'd like to make a motion that we approve the purchase and have the county manager execute it to the Collington Fire Department for $20,687.39 for the purchase of a Striker Lucas device.
Okay, there's a motion on the floor. Is there a second? I'll second the motion. Floor is open for discussion.
How many such devices are currently in our possession as part of Dare County EMS? Do you know?
Not the total number,
8?
but you have one in every active ambulance. Right?
So we've got at least in every ambulance. And we have, do you know how many ambulances we have? I'm trying to figure out whether we have 15 of these or
12 to
10.
15 on the road anytime.
Okay, so we've got 12 or 15 already deployed and ready to go. And do we know if Collington Fire, and not that you would, Steve, I'm not trying to put you on the spot. I'm trying to figure out if this is a 1 in a 10 million opportunity that might be missed, and are we just buying it that it's gonna, that we don't have adequate coverage? I heard everything you said.
Yeah.
It just feels like we're really, I don't know. I'm not opposed to it. It's a good thing. It's like, you know, are you opposed to the children? No, I'm not opposed to the children. But if we buy it, is it gonna sit in dust for 5 years? Because frankly, EMS was there within seconds from EMS 1.
Well, EMS 1, even back to Collington Fire Department can be there anywhere from 3 to 4 minutes even before EMS gets there. And they have this machine already set up.
Do we know if we've ever had an instance where they said, oh my God, if we had had this, patient X would be alive today, but they died?
There's no way to say patient X would be alive today.
Yeah, not trying to put you on the spot. I'm not saying that is possible. I just didn't know if they said,
They're
Steve,
trying to
here's,
prevent that. Just
there's
that.
3
They're trying to
instances
prevent just
where
that.
we lost them. So, okay.
And like I said, with Collington being the way they are, they can at times be cut off and they're
Yeah,
just
isolated back
from EMS 1.
Do any other fire departments, do we know?
None of the
these?
other ones have them because EMS is readily available to everybody else. And not really cut off as much as like the population-wise as Collington would be.
Yeah.
The only other department I could think of would be Hatteras Village.
Yeah.
But
Okay.
Steve, how about, and I understand this too, but how about, like Kitty Hawk, for instance, going to Kitty Hawk Landing, they're 4 minutes away from there. EMS is what, 10 minutes out?
no, less than 6.
EMS is 6 minutes out to Kitty Hawk Landing, and the fire department's there in 4 minutes,
Yeah.
3 minutes. Okay.
Anyone else have any questions of Steve? Then I'll call for the vote. For those in favor of that motion, signify by saying aye. Aye. Those opposed? Motion carries unanimous. Thank you, Steve.
Thank you, gentlemen.
I'll come, do you have anything else? I'll come back to you
If you
since
come
we
back to
were
me,
under
yeah.
county
Yeah,
managers.
we'll come back.
I'll go to our public information officer first. Ms. Hester, do you have anything?
No, sir, not today.
Thank you. Our county finance director, Mr. Clausen, you have anything else?
No, sir.
Thank you. All right, it's time for commissioner's business, and I'll come back to you, Commissioner House.
Thank you, Mr. Chairman. On January 19th, I had the pleasure of being at the Duck Research Pier where they did the ribbon cutting for the Annex Department building there. It was a $4.5 million project. And Dr. David Pittman, who was the head guy in charge of the research department for the Army Corps of Engineers, and very remarkable remarks from him. He was actually reflecting back on the history of the research pier, as it started out with 1 amphibious boat and 7 people. And now we have that wonderful facility that's out there now. And his comments were, in a nutshell, that Dare County beaches are the most studied beach anywhere in the world. With the research pier, with all the work they're doing there. So it was very remarkable, very rewarding to be there for that. Miss Katie,
She went down to Hatteras on January 26th, conducting a maintenance project on the connector channel. The connector channel is now 8 to 10 feet all the way through there. They dredged approximately 14,172 cubic yards. And to put that in perspective, that's 1,400 dump trucks for the sand they pulled out of there. And they'll be doing they're working on the current survey now for it. Another remarkable instance that happened on 1/31 of this year. First time in 7 years. The Linda Gale and the Sheila Renee, both trawlers out of Wanchese. As you see the picture on the board. First time loaded trawlers were able to come through Oregon Inlet in the past 7 years. They were fully loaded and offloaded there in Wanchese. And congratulations to Craig Tillett.
When was this picture taken?
This was taken on 1/31.
I don't have it on my screen. I'm just curious.
Yeah, it's up there.
You gotta have a magnifying glass to see it.
Yep. So,
how come we don't have it on our screen?
I don't know. So that's very remarkable for that to happen. Usually they would have to go from Wanchese down the Sound all the way to Moorhead to get out. So like I said, it's the first time in 7 years they've both been able to come in loaded. So that's good news.
That's great news.
Part of sad news, Senator Tillman, North Carolina Senator Tillman, who was instrumental with the commercial fishing in his time in the North Carolina Senate, since has been out of the Senate for that last couple of terms. Unfortunately, he passed away this past week, and I want to send his condolences to his family for that loss. Our day in history, 1952, Queen Elizabeth took her role as the Queen of England after her father unexpectedly, King George VI, passed away, and she was the longest termed royal monarch in history. And one of our best parts of any commissioners meeting, I think we have a pet of the week. Meet Wendy.
Our pet of the week this week is Wendy. Wendy is a super sweet and vocal boy who was brought to us when his owner passed away. Wendy loves to play and explore.
I was just watching up there.
He has been the only cat his whole life, but does seem interested in other cats here at the shelter. To adopt Wendy or foster one of our other animals, you can visit us Monday through Saturday at our shelter located in Manio. For more information, visit our website at www.obxspca.org or visit our OBX SPCA Facebook page.
So if you get a chance, run down to SPCA and pick up Wendy. She needs a forever home. And thank you very much, Mr. Chairman.
Thank you, Commissioner House. Commissioner Ross?
Okay, thank you, sir. March, for everyone's information, I'm sure you're aware, is our March for Meals initiative, where we are all encouraged to take a route with our Meals on Wheels folks, especially with Sandy Pace and her team here, and I plan to do so, and it's a very worthwhile endeavor to bring awareness to the incredible work done by our Albemarle Commission friends, as well as our local Virginia Tillett Center. So I encourage everyone to do that if you can. Number two, I've just misplaced my folder. On February the 12th, between 2 and 5 p.m. at Theater of Dare, there will be a Have a Heart for Dementia Care. Our general expert memory care folks and the Theater of Dare will have music and play reading, all to bring awareness and raise funds for dementia care here in Dare County. That's February the 12th between 2 and 5 at the Theater of Dare. On the 23rd, we have the Chamber of Commerce sponsored Economic Summit at the Ramada in Kill Devil Hills. 8 o'clock that morning, breakfast and an economic summit should be very good. On February the 25th, this will be designated Knucklehead 1, Knucklehead 2 Day, as Commissioner Bateman and I will be taking a dip off Jeanette's Pier for Special Olympics in the polar plunge at 10 a.m. that day. That's February 25th. Unless, of course, I'm out of town or something, and then I won't be able to go in.
Convenient.
Conveniently out of town. Ms. Hester, I just want to say I hope to see hundreds of live oaks springing up across Dare County as post-State of the County address has provided live oak plantings for so many. And finally, congratulations to all of our pin recipients this morning, but special congratulations to Amy Elkins, our Employee of the Year, and for our own Jackie Tillett back in elections. Well done. Well done. Thank you, sir. That's all I've got.
Thank you, Commissioner. Appreciate it. How about Commissioner Couch this morning?
I'm good today, thank you.
Commissioner Bateman?
Everything's fine and well down south.
Good. Commissioner Bateman?
Yes, sir. Me and Commissioner Couch went to the oyster roast Coastal Federation put on. It was cold, but the oysters were delicious. A lot of fellowship, and Senator Norm Sanderson was down there also, and got the opportunity to speak with him about some county business. So everything was good. To expand on Commissioner Ross's about the 25th of the Special Olympics, this is also, the challenge is also extended to all Dare County employees. It says here, Special Olympics Dare County is challenging Dare County employees to come out.
Come on, Dare County
And
employees.
take a dip too. And that means also Dare County commissioners.
Lay down the
What was
gauntlet,
the-
Commissioner
what was the
Bateman.
time?
Lay down the gauntlet.
What was the time?
25th.
10 a.m.
10 a.m.
At 10 a.m. You register at 9 p.m. You get a free T-shirt, great fellowship, and it's not that bad.
No, it's not bad at all.
After you get out of the water,
51,
it's
52.
actually
Now,
warmer
you
out of the
act
water.
like these guys act like we ain't never done this before. I've done that like
Hey,
7 or 8 years
hey,
in a row.
what have you done for me lately? Don't rest on your laurels.
They gotta publish, they did it last year, and they're gonna do it this year. They're giving us a hard time. I've done it in the past many times.
All right, Chicken Hawk.
I'll be there.
Step
I'll
up
be
to the
there.
plate.
I'll be there.
And y'all too. I'm done.
And I don't wanna see you just tiptoeing in the water. I
You
wanna
won't.
see you diving in. I don't wanna see y'all tiptoeing. I've seen that too. I wanna see
fell
you
in last
diving
year.
in. I love it.
It is having good fun.
Oh, Lord. Thank you, Commissioner. Anything else?
That's it.
Vice Chairman?
Thank you, Mr. Chairman. Like to also say thank you to our service pin recipients, Radcliffe, April, and Melissa. They knocked it out of the park with 45 years of service. Seems like this happens every month. It's always a pleasure saying that. Also want to congratulate our Employee of the Year for 2022, Amy Elkin. Just great work. And I want to say a special thank you to our Employee of the Month, Jackie Tillett, with her 38 years of service. Now that she's got her training program completed, we can really look forward to the next 38 years.
Yeah, she'll be coming out of the intern
and it
program
really
here
ought
any day.
she ought to get through it with a breeze. I just think she'll just glide right through it. But thanks a bunch, Jackie. Before you have a resolution. It seems like it's resolution day. But we have a resolution that's requesting the North Carolina General Assembly to revise and expand the Good Samaritan Law. And just for information, the Good Samaritan Law was put in place to allow people who were in a situation where there was a potential overdose to call the police or call authorities and have them come and address the person in danger without fear of prosecution. This law, when it was first enacted, was a model, actually. North Carolina's law was actually a model for other states. But over the years, this has, it's kind of fallen behind. There are just new substances and just new things that they're having to deal with. There are a number of groups in North Carolina that have gone to the legislature and have asked for help in this regard. and they have gotten into the nits of it. This is a more general resolution requesting the revision and expansion of the law. And Bobby, if you have a copy of that, if you would read it, I'd appreciate it.
This is a resolution requesting the North Carolina General Assembly to revise and expand the Good Samaritan Law GS 90-96.2. Whereas the North Carolina General Assembly adopted GS 90-96.2, also known as the Good Samaritan Law, in 2013. And whereas the North Carolina General Assembly Good Samaritan Law was recognized as both timely and one of the best in the nation. Whereas as a result of this law, a number of lives in North Carolina have been saved, specifically from opioid overdose and fear of prosecution. And whereas people are still too often deterred from calling for help at the scene of an overdose if they fear arrest and prosecution, which undermines the very purpose of the law. And whereas continually rising overdose fatalities show that North Carolina's current Good Samaritan law fails to provide adequate protection to ensure individuals feel safe and willing to call 911. And whereas since the passage of the Good Samaritan Law in 2013, several new substances have become threats to the lives of our citizens. And whereas these new substances are not specifically designated and are therefore not covered by the current law, resulting in unnecessary and tragic deaths. And whereas while the current Good Samaritan Law has helped save lives in the past, it is apparent that the law needs to be revised and expanded to include a wider range of threats to our citizenry. Therefore, be it resolved that the Dare County Board of Commissioners requests the North Carolina General Assembly to urgently consider revising and expanding the Good Samaritan Law to include a broader spectrum of substance-related threats to our citizenry as a matter of public safety. And be it further resolved that the Dare County Board of Commissioners believes that this action will ultimately save people who will have the chance to recover and go on to have meaningful and productive lives in our communities. This is the 6th day of February, 2023.
This is a resolution presented by the Vice Chairman. Is there a second?
I second it.
Seconded by Commissioner Bateman. Any further discussion? Hearing none, those in favor signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimous.
Thank you, Mr. Chairman. I want to mention that we plan on, upon passage of this, sharing this with all of the other MCOs. I plan to get it into the hands of Trillium, who is the MCO that works with Dare County, and get them behind it, as well as other county boards to consider it as well. But thank you for doing that. Finally, I want to mention that we plan to have the Wall That Heals is officially coming to Dare County in November of this year. This has been done through the Veterans Advisory Council, and it will be at the Soundside Event Center. Presentations are ongoing to all of the towns. We're kind of giving a video and an explanation of what this is, and we're going to get on the agenda here for the Board of Commissioners very soon and do the same presentation. This is a 3/4 scale replica of the Vietnam Veterans Wall in D.C., and it is an exact replica. It's going to be here for about 4 days. It will be open 24 hours a day, and folks can come see it at any time that is convenient to them. So we're really looking forward to that, and there'll be more information coming on that as we move along. And, Mr. Chairman, that's all I have.
Thank you, Vice Chairman. In addition to that, met with Dorothy, and I met with, what's her name?
Patty O'Sullivan.
Patty O'Sullivan. They're short about $5,000 to make this happen, and I'd like to make a motion that the county provide that $5,000 to cap this off the amount of money that they need to put this on.
Second.
It's been seconded by the Commissioner House. Any further discussion? Hearing none, those in favor signify by saying aye.
Aye.
Opposed, like sign. Motion carries unanimously.
Mr. Chairman, let me mention this too as
Yes,
well. Thank you for that. And what we're going to do, what we're asking people to do who want to make donations to this, either volunteering their time or volunteering some funding for it. Any of the funding that is done for this project will help to bring the wall here. maintain it while it's here with volunteers with regard to food and things like that. But also any leftover funds that we have will be used by the Veterans Advisory Council for the benefit of veterans to support programs that they have ongoing, helping veterans throughout the county. So
Well,
just want to make that clear.
Do we know where here is, Wally, in Manteo or over on the beach, where if they bring it, is it going to move?
Oh,
Do we
no,
know
no,
that?
no, no. It's set up. It
Yeah.
will be at the, over on the Soundside Event Center, and it's spread up. It's quite a spread. And when
Yeah,
you see
okay.
the,
When you said 3/4, I thought, this is really big.
it is
This is
big.
not
Yeah,
small.
oh, yeah.
Okay.
It's pretty special. And we'll do a presentation here possibly next month. And if it's, if it's convenient to get it on the agenda, and you'll see what it's like. It's really special.
Super.
Yep.
Super. All right, anything else, anyone have anything else for the good of the board today? If not, then we need a resolution, a motion, I see Wally said the day of resolution. We need a motion to adjourn until 9 a.m. on March the 8th. 6th. Motion by Commissioner House. Yes. Seconded by Commissioner Bateman. Any further discussion? Hearing none, those in favor signify by saying aye.
Aye.
Opposed, like sign, motion carries unanimous.